All right, now that we are all here, I guess we can begin. Okay. All right.
Okay, for our side.
Thank you, thank you. So good morning again, colleagues, and welcome to the 5th meeting of the Program Steering Committee for the 11th VDF, Strengthening Climate Resilient Health Systems in the Caribbean Program. I bring you greetings on behalf of our Director General of CARIFORUM, Ms. Alexis Downs, Amsterdam, who is unavoidably absent for today's meeting. Because of this, I am pleased to be sitting in for the Director General as the CARIFORUM representative on this meeting of the Program Steering Committee. I want to take this opportunity to extend a warm welcome to everyone present to this 5th meeting of the Program Steering Committee. We are very pleased to have our partners from the EU delegation in Barbados who will co-chair this meeting with us. We are also pleased to welcome the representatives from the CARIFORUM states and the implementing partners who will be participating in today's meeting. Colleagues, the 11th EDF Strengthening Climate Resilient Health Systems in the Caribbean program is valued at Euro 8.6 million with an EU contribution of 8.3 million and the balance of the contribution from PAHO. The financing agreement was finalized in April 2020, and the program has an implementation period of 60 months. The overall objective of the action is to improve the capacity of Caribbean countries to reduce the negative impacts of climate change on health and strengthen healthcare systems. The specific objectives are to increase the capacity of Caribbean countries to adapt to and to reduce the effects of climate change and other health risks on public health, using the One Health approach within the CARIFORUM Caribbean Cooperation in Health Phase 4 framework. There are 4 expected outputs under the program, and a number of indicative actions have been proposed to achieve those expected outputs. The action is being implemented in 2 parts, as you would know. One part is being implemented by the PAHO Office of Sub-Regional Program Coordination for the Caribbean, and the other part is being implemented by the PAHO's representative in Haiti. The financing agreement requires the establishment of a program steering committee, as we all know, which covers both of the projects, the sub-projects, and the Program Steering Committee is expected to oversee and validate the overall direction and policy of the action. The PSC is expected to review program progress and performance on a periodic basis. I think the FA makes provisions for 2 PSC meetings per year. The PSC at this time is chaired by the Secretary General of CARIFORUM or her representative. However, as we have been doing in practice, we continue to invite the EU to co-chair the PSC with us. This sort of partnership is one that we value, and for this particular program, we look forward to finalizing the arrangement to have both the EU and CARIFORUM serve as co-chairs to the PSC. Revised terms of reference for the PSC, which includes the roles and functions, the composition, and some of the administrative arrangements, has been circulated for consideration of today's meeting. I believe the first iteration of the TOR that was circulated was the old one, incorrect one, but I am advised that this was corrected and everyone should have access to the revised terms of reference. The PSC has met 4 times since the FA was finalized. Today's meeting is the 5th meeting. We do see these PSC meetings as very important to allow for discussions on progress with the various components, as well as any challenges that may be experienced to guide the way forward. based on the implementation period, we are essentially at the halfway point of the implementation of this program. We know too that an ROM review was done and a number of recommendations have been made. The report of the ROM review has been circulated to the PSC as well and is expected to be discussed at today's meeting. So once again, I'd like to welcome all of you and look forward to very fruitful discussions with a view to steering this program in a manner that will yield the expected results. On behalf of CARIFORUM, I also want to take this opportunity to express our thanks to the EU and PAHO for providing the resources to support this very important program. Colleagues, an agenda has been circulated. The next item on the agenda is brief remarks from Mr. David Mogolon, Head of Cooperation of the EU Delegation to Barbados and the Eastern Caribbean countries. And so whilst we do not have an item on the agenda which requires adoption of the agenda, we will just go through the presentations as outlined in the agenda. And so at this time, I invite our partner and co-chair from the EU, Mr. David Mogolon, to provide us with a few remarks. Thank you, David. It's over to you.
Thank you very much, Ivanette. I hope you can hear us loud and clear.
I can.
Good, excellent.
I am hoping everyone can hear you. I've been trying to turn on my video, so please bear with me if you do not see it on. It's showing that it's on, but I'm not sure that you've seen me yet. Okay.
Not yet, but we appreciate that because we feel very lonely. The only ones with the video on. Excellent, better now. Thank you. Yeah, well, I just wanted, and this is much better. Now we are really in a meeting all together. Okay. Now I just wanted to highlight a few issues. One is I wanted to outline how important the sectors, the areas that are addressed by this program are for us. Climate change and health they figure very high in our priorities, not only in our regional program, but also in the discussions we had yesterday. You might be aware that yesterday and the day before took place the EU CELAC summit with the heads of government and presidents of the 60 countries of the European Union member states and the Latin American and Caribbean regions. There was a joint declaration where both health and climate change, they appear very high in the agenda, in the common agenda, joint agenda, to work together on these global challenges. And as such, health and climate change are part of the Global Gateway Investment Agenda that was presented to the heads of government as an area where we can work together from both regions to try to increase, promote, facilitate investment in those areas. And for example, strengthening the resilience of health systems in the Caribbean is one of the areas that we wanted to appear very, very strongly. So just to say, this will be an important milestone, this program we are doing together. And actually, an important element of the way how the Global Gateway Investment Agenda is designed. Because normally what we try to do is to bring together European investors with our tools from cooperation to address the can be legislative framework or capacity building of our partner countries in the region, or linking to concessional credits, or all kind of issues that can make sure that we have a comprehensive package to address the needs of our partner countries. So this is one component that should be part of the basis for future engagement of the European Union in that sense. But we are very happy with the program in the sense that it's really supporting the nexus between climate and health. That this is something that is a connection that is not always well brought together. We would like to congratulate PAHO for its efforts and the project team for the work in the policy space with the successful completion of a number of NAPs, the commitment to building a network of climate and health leaders as you head into the 5th call under the Climate and Health Leaders Fellowship, and the positioning of health in the climate space through the piloting of the WHO PAHO tools and early warning systems, among others. For sure, the program is going through some challenges, and we have the ROM evaluations that we launched that are supposed to identify what are the challenges related to efficiency, efficacy, to whether the results are going to be sustainable, etc., etc. And so, of course, some issues have been identified, and I think this is the right framework, the right space to address those, and there will be a space in the agenda for that. So we are happy that we will together provide the necessary attention to those challenges. And I would like to also to congratulate ourselves for the successful completion of the operational assessment of the program. I'm very happy to be here because I really think that this space, this steering committee, together with CARIFORUM and the members of the PLC, is really an excellent space to provide strategic guidance and support for the right implementation and successful completion of the program. And I just wanted to mention that we know the advanced stage of actions under the Haiti component, which facilitated national action to strengthen the health system in response to the COVID-19 pandemic. And we look forward with great interest for hearing about the successes coming out of that work and how it has served to support the sector and respond to an international crisis in very difficult circumstances. Thank you very much to all.
Thank you very much, David. Thank you. Lisa, I recall before we started, there was an indication that we were only expecting the EU delegation. I know that we did not do a roll call, but before we move on, I would like to invite participants to introduce themselves because I believe it's important that we establish that we have a quorum even before we proceed. So before we take the remarks from the Director of PAHO Sub-Regional Office, I invite all of the participants on this call to introduce themselves. I will begin. My name is Yvonne Baron George, representing the CARIFORUM Directorate. David and Donna, I will move over to you.
I'm
and then
David Mogollon, Head of Cooperation at the EU delegation here in Barbados, but covering Barbados, OECS countries, CARICOM, CARIFORUM, and the regional programs for the Caribbean.
Donna Gittins, I fall under David's wider operational team, program manager for the climate change portfolio, and have oversight over this particular contract.
I can go next and we can go down the line. Maybe that will be helpful. So I'll go down the line of the participants. So I'm Lisa Bailey. I am Communications and Visibility Coordinator for this project, and I'm Specialist Communications for Health Promotion for the Caribbean Sub-Regional Office. I'll let us go in order so it's easier. Annie's next.
Good morning, Annie Harris, Admin Assistant to the Climate Change and Health Project. Thank you.
Atiba.
Good morning.
Good morning, everyone.
Go ahead,
Hi,
Atiba.
good morning. Good morning, everyone. My name is Atiba. I'm the Project Support Specialist.
Thanks, Atiba. Francois.
Hi, everyone. Merisma Francois, Program Manager for EU Delegation in Haiti. It's a pleasure.
Thank you. Diana Ruiz.
Good morning, everyone. My name is Diana Ruiz, Project Manager at the Caribbean Community Climate Change Center, 5C.
Thank you. Welcome. Adrian.
Hello, good morning. I'm Adrian Trotman, Chief of Applied Meteorology and Climatology and head of the Caribbean Regional Climate Center at the Caribbean Institute for Meteorology and Hydrology. Thank you.
Thank you, Adrian. Nice to see you. Alain Perodin.
Yeah, good morning. Good morning, everyone. I'm Alain Perodin. I'm advisor for health governance and financing at the PAHO office in Haiti.
Thank you. Orita Zachariah.
Good morning. I am pleased to be here. I am functioning as the chair of the CHAG, and thank you.
Thank you for being here. Adriana.
Good morning, everyone. I'm Adriana Thomas. I'm a PAHO consultant and the project coordinator for the EU CARIFORUM project. Nice to meet all of you.
Thank you, Adriana. Dr. Booth.
Good morning to all. My name is Daniel Booth. I'm the Unit Chief on Climate Change and Environmental Determinants of Health at the Pan American Health Organization, and I'm based in Washington, D.C.
Thank you, Dr. Booth. I hope you have better air up there today. Dr. Paulson.
Morning, everyone. Thanks. Yes, Lisa, it's raining, so the air seems cleaner. Karen Paulson Edwards. I'm the Regional Advisor for Climate Change and Health with PAHO based in Washington, D.C. Thank you.
Thanks, Dr. Paulson. Laura Lee.
Hi, good morning, colleagues. Laura Lee Badran, head of our Caribbean Regional Field Epidemiology and Laboratory Training Program at CARIFORUM.
Thanks, Laura Lee. Dr. Birmingham.
Good morning, everyone from the PAHO WHO office in Haiti. My name is Maureen Birmingham. I'm the PAHO WHO representative here. Nice to be with you all today.
Nice to see you, Maureen. Thank you. Michelle.
Good morning, everyone. Michelle Small-Bartley, representative from the CARICOM Secretariat, Deputy Program Manager for Youth Development. Thank you.
Thank you. Nyama Kelly.
Hello.
Sorry,
it's okay. Good morning, everyone, and apologies for my camera not working. I'm using a different laptop. I'm Neve Kelly Omolo, Program Support Officer with UNEP Caribbean Sub-Regional Office based in Kingston, Jamaica. Thank you for having me here.
Thank you, Ms. Kelly Omolo. Cicero Simon.
Good morning, everyone. I am Cicero Simon, the acting head of the Human and Social Development Division at the OECS Commission, which comprises education, health, and social development. A pleasure to be here. Thank you.
Thank you, Cicero. I'm sorry I mispronounced your name. Stefano Todd.
Good morning, everyone. Stefano Todd, the Portfolio Coordinator at the Ministry of Health, Dominican Republic.
Thank you very much. Mr. Shah is our...
Hi, good day, everyone. Dr. Shah, Valinor Research, we are offering. We're providing administrative reporting services to PAHO Project Office. Thanks.
Thank you so much. We appreciate that. Victor Carr.
Good morning, everyone. I'm Colin Victor. I work as a consultant in PAHO offices of Haiti.
Okay, thank you very much. I think maybe we should just rename ourselves so that we have our names and our organizations. That may help the chairs in the process. Thanks very much. I think that's everyone.
Yes, thank you for that, Lisa. I think so too, because we needed to establish that we do indeed have a quorum for this meeting. So thanks everyone for your introductions. I believe the next item on our agenda is brief remarks from Mr. Dean Chambliss, Director, PAHO Caribbean Sub-Regional Office. So I turn over to Mr. Chambliss at this time to deliver some brief remarks. Mr. Chambliss. Lisa, can you confirm whether he's on, please? Thank you.
Mr. Chambliss is actually on duty leave. Let me just refer to the agenda 1 second, please. I believe, correct.
Dr. Booth.
Dr. Booth will step in here, yes.
No,
Noted, thank you for that. Yes, thank you.
Very much.
Over to you, Dr. Booth.
Thank you very much. Let me first just apologize on behalf of Mr. Dean Chambliss, the Director of Caribbean Sub-Regional Office of PAHO, who could not be with us today. So I'll just read some remarks and add some on my own. Chairperson is Yvonne Baron George, Mr. David Mogallen, Ms. Donna Gitnis, Mr. Francois Meritzma, Dr. Maureen Birmingham, our colleague in Haiti, representative partners, and other PAHO colleagues. Good morning. This meeting provides an opportunity for project stakeholders to share updates on the implementation of both projects, strengthening climate resilient health systems in the Caribbean and maintaining essential health services during the COVID-19 crisis in Haiti, for which this committee provides oversight. Both projects are of extreme relevance now more than before, as we see the worsening impacts of climate change on health and on our health systems. Climate change is recognized as one of the biggest challenges for the 21st century, and we therefore have to move with urgency to assist member states to implement mitigation and adaptation measures aimed at reducing the associated health risks to our populations. The Caribbean region, which is the largest group of SIDS globally, is particularly vulnerable to the impacts of climate change and has been negatively impacted by repeated experiences of extreme weather and climate events and related health impacts, such as vector-borne and airway diseases, food and water insecurity, mental health affections, forced displacements, just to cite a few, which have resulted in loss of lives, livelihoods, and ecosystems while hampering economic development. The projections indicate that temperatures will continue to increase, sea levels will continue to rise. The direct and indirect impacts of climate change on health will result in added stress to already overburdened health systems and increased illnesses and death. Unless we do something together, the Caribbean Action Plan on Health and Climate Change 2019-2023 has been our guiding document for building and strengthening climate resilient health systems for the past few years. We have, under the 4 strategic lines of action under this plan, agreed by Ministers of Health, Environment, and Planning of the Caribbean, these following lines of action: empowerment, building evidence, increasing implementation, and mobilizing resources. And with the support of the EU CARIFORUM and in partnership with CARICOM, CARFA, CIMH, 5Cs, and UE, and other partners, we have been able to implement activities towards achieving these goals. As referenced by Mr. David Mogallen, yesterday the EU-CELAC Summit issued an important joint declaration that highlights the importance of tackling climate change while recognizing the effects on health of these environmental drivers, not only climate change, but also other environmental drivers, such as the sargassum spread and other related effects. European Commission commissioned a results-oriented monitoring ROM review that was also referenced here today of the EU CARIFORUM Climate Change, Strengthening Climate Resilient Health Systems project in May this year. And the results of this review will be presented in this meeting, and we will have the opportunity to discuss some of the recommendations and plans to address them. Through the project, we have made some achievements, we have had some achievements which we can be proud of. But we are also cognizant of the fact that there's still a lot to do. We need to continue to work on strengthening governance and institutional structures to prioritize climate change adaptation and resilience planning in the health sector. That would include the collection of baseline information to build an investment case through the development of portfolios of climate and health projects tailored to strengthening healthcare systems to improve their capacity to respond to climate-related health challenges. This particular work is being done in partnership with all the partners here, but particularly with the 5 Cs, while we are developing these portfolios of projects and building these climate programming with countries as the Green Climate Fund, to cite a potential donor for the future, call it. Also, we need to raise awareness about the impacts of climate change on health while promoting adaptive strategies and encouraging behavior changes to reduce vulnerability. Also, we are developing early warning systems that can alert communities and healthcare providers about impending climate-related hazards in partnership with CARFA and CIMH. We're also building through this project capacities through a fellowship program and youth leadership in partnership with UWI and others. And as doing so, we are engaging the civil society and youth leaderships, among other activities that are being done and that will be discussed in this steering committee review. As the project enters its 4th year, we are already thinking of ways to sustain the outcomes, so beyond the end of this project. A proposed framework will be presented in this meeting by PAHO through Ms. Adriana Thomas, the project coordinator, with the support from colleagues of the PAHO Caribbean office, and from here, PAHO headquarters, with the presence of Dr. Karen Polson, our regional advisor on climate change and health. During this year, we will begin drafting a new action plan for the Caribbean, and it presents us another opportunity to relook what we have achieved and define a plan for the next 5 years, 2024-2029. Together, we continue to work to build climate-resilient health systems as we seek to protect the health and livelihoods of Caribbean populations. And let me just add a few more notes that I think it's important that this committee takes note. The government of the Netherlands, together with countries of through WHO, we are supporting that in the region of the Americas, are proposing a resolution at the next World Health Assembly on a global program on climate change and health. This also presents a unique opportunity to increase this topic to global levels. And this is also going to be discussed here in October during the UNFCCC Climate Week in Panama. So PAHO is working to have sessions tailored to health and climate change in this particular meeting to provide guidance for the next COP, COP28. Also, during COP28, PAHO will be sponsoring and supporting the participation of ministers of health during the Health Day at COP28, which is December 3rd. So the idea is that we can have the community of health represented to discuss with climate change community at the COP to strengthen and to build this global program on climate change and health, with WHO and PAHO particularly in the region supporting these initiatives. And also we are seeking to have here in the region of the Americas a similar resolution tailored to the region of the Americas, focused on countries and particularly in the Caribbean at our next directing council at PAHO next year, September next year. So that gives us, I think that this project is one of the most successful examples that we have on how to tackle the health effects of climate change. This has been extremely successful in our opinion, although we have some challenges to resolve. And countries of the region are constantly asking us to provide information from this project because they are willing to replicate in their own context. So with that, I would like to say that we are here with you. I hope that you can continue to collaborate together with this project and future projects to come. And I wish you a productive and a fruitful meeting. So thank you very much for the attention.
Thank you very much, Dr. Boss, and thank you to PAHO for all of the support to the region. We too also look forward to the continued collaboration and support to implement this very important climate-related projects in the region. Thank you. Okay. Colleagues, our next item on the agenda is brief remarks from Dr. Maureen Birmingham, a representative from the Haiti PAHO country office. Lisa, can you confirm that Dr. Birmingham is on, please?
Yes,
Thank you. Welcome, Dr. Birmingham. And I hand over to you at this time. Thank you.
Thank you very much. And once again, good morning from the PAHO WHO office in Haiti. And just to complement Dr. Bruce's comments, it is also for us an honor to join our other PAHO colleagues and join all of you to take part in this important EU CARIFORUM PSC, given Haiti's inclusion in the initiative on climate change, resilient health systems in the Caribbean, as well as the project specific to Haiti on maintaining essential health services during the COVID-19 crisis in the Northeast Department of Haiti. We applaud the vision of the EU to recognize very clearly the role of health in the climate space. And we consider this PSC as an important opportunity to take stock and to receive your frank feedback. While Dr. Alain Perraudin and Dr. Caroline Victor from our office will be making a full presentation on this Haiti-specific project during this PSC, I would just like to emphasize briefly 3 key points. My first point is that health systems can build resilience to climate change if they have effective governance, if they use models of service delivery that are adaptable to highly variable and dynamic circumstances, if services are sufficiently and appropriately decentralized with clear definitions of roles at each level of the system, and if the system is results-based. So this important EU-funded project was based on these principles. And you will hear about a number of measurable achievements, despite the very difficult context that you're all aware of in Haiti. There were, of course, challenges as well. And this relates to my second point, that the lessons learned and the experience gained from this project will also positively influence the implementation of the new EU-funded project in the Southeast Department of Haiti. And my third point is just to reiterate once again that we are grateful for the EU support and the partnership in this area of health systems resilient to climate change. We are confident that these initiatives are producing results on the ground in Haiti, and we will continue striving for sustainability of these results. Thank you very much.
Thank you, Dr. Birmingham. And yes, as a PSC, we do look forward to hearing of some of the achievements and but most importantly, some of the lessons learned from the challenges that will be reported. As you rightly noted, yes, it did. And David would have spoken about it earlier. The climate change and its effects on the health system is really critical, and it's something that we've all recognized that we need to give attention to and work together jointly to ensure that we do not experience the negative effects of it. Thank you. Colleagues, at this time, we have come to the end of the opening of the meeting. And so the next item on the agenda is the overview and approval of the minutes of the steering committee meeting that was held in October last year. We will take the minutes. I will go through the minutes page by page. We will not necessarily go into it by detail, but feel free to, when we would have identified the relative page, to state any changes or any comments that you wish to make on the page. The minutes were circulated along with the documents on the documents link, and then we will take the action points that have been highlighted, and if necessary, probably await the presentations from the implementing partners that will provide us with further details on some of the action points that have been listed in the minutes. So colleagues, page 1 of the minutes. Page 1 is the list of participants. I see one slight error, but it's something that it just is spelling of my name, but I will set the correct spelling to the administrative officers. Page 2, there are any matters on page 2, any corrections? Page 3 of the minutes. Page 4. On page 4, there is an action item, and it relates to revisions to the terms of reference for the PSC and CHAG committees. I can report that the changes have been made and to the TORs, and these have been circulated for consideration at today's meeting. So if there are any further matters on these changes, they can be addressed when we take in that particular agenda item.
Okay. Good day, Chair. Just one correction on page 4.
Please proceed.
Under output 3, during the reporting period, CARIFORUM has been continuing assessment exercises with selected countries, not assimilation.
Okay, thank you for that. Page 5. Page 6. Page 7. And on page 7, there is an action point relating to updates on the year free work program. And that action point just states that both the work plan and the the budget for year 3 were approved in principle. On page 8, the 2 action points on page 8, the one relating to the Haiti project, and that the activities were accepted by the PSC, as well as the planned activities for the next period. The other action point is relating to extension of the project. Can we receive an update as to whether that extension has been requested and granted? Is there any update on that action point?
Annette, do you want to make a comment on that? My understanding was it was extended.
Okay,
Yes.
thank you.
Yeah, if I can make a quick comment on that. Yeah, the project was supposed to end on February, and we obtained the extension, which allowed us to finish the project last June.
So the project was extended from February to June. Is that
Exactly.
what I'm hearing?
And now,
Okay, so that means, sorry, could you continue? Sorry.
now right now the project has closed.
Okay, noted. Thank you. That was what I wanted to confirm. Page 9. Page 10. Page 11. On page 11, there was an action point. Partners to expand discussion on sustainability and sustaining the project outcomes. Can we receive an update on that action plan, please?
Madam Chair, we will be submitting, we will be presenting on our proposed sustainability framework, which is a response to that item on the agenda, in the minutes.
Thank you, Adriana. Remember, I did indicate that where possible, we may receive those updates during the presentation. So thank you. Thank you for that. Okay, our final page of the minutes is page 12. And on page 12 as well, there's an action point. UE and FAHO to address the language challenges so that applications from Cuba and DR could benefit. And UE and PAHO to explore additional options to address low participation from smaller countries, such as St. Kitts and Nevis in Fellows program. Will we always also receive an update on that in the presentations, or can someone provide an update on these action points, please?
Yes, Madam Chair, you will receive an update on that item in Dr. Paulson's presentation, as well as in our status update. Thank you.
Thank you, Adriana. Colleagues, can someone move that the minutes as circulated is adopted, please? Can everyone hear me? I was asking for someone to move that the minutes that are circulated, the minutes are circulated, are adopted.
Good morning again, everyone. Minutes accepted. Thank you.
Thank you, Michelle. Thank you. Do we have a seconder?
Good day, I second.
Thank you, Laura Lee. Thank you. Okay. Thank you. All right, with this, okay, thank you. This brings us to an end of the agenda item. overview and approval of the minutes of the fourth PSC. The next item on the agenda is the approval of the revised terms of reference for the Program Steering Committee and the Climate and Health Advisory Group. Colleagues, the terms of reference for both of these groups have been circulated. As I would have indicated earlier, the terms of reference for the steering committee, for the Program Steering Committee, was circulated, and as well as the terms of reference for the Climate and Health Advisory Group. We'll take them one at a time. Welcome, Mrs. Royer. Did you want to make an intervention on this?
No, just no, sorry. My mic was on, just to say good morning to everyone. Yes.
Good morning
I
and
thought
welcome.
Actually, I was told by Vanessa the meeting starts at 10, so I was just there waiting.
Okay, sorry.
Yes.
Yes,
I'm
yes, but
here.
the time was changed from 10 to 9. But welcome and thank you for joining us. Yes.
Okay, thank you, my
Thank
dear.
you.
Thanks.
Yes. As it relates to the steering committee for the terms of reference for the Program Steering Committee, a number of changes were proposed and that was circulated. The CARIFORUM Directorate has agreed to most of the changes, and we would like to recommend that the changes to the Program Steering Committee are adopted, with the exception of the change relating to the chairing of the committee. That change will be finalized following the amendment to the financing agreement. So an amendment to the financing agreement is being proposed to reflect the chairmanship of the steering committee for this program. And so, colleagues, I put it to you to provide to make any intervention on the revised terms of reference for the steering committee that has been circulated. Donna and David, I invite any feedback from you as well. As you know, there were several exchanges between the CARIFORUM Directorate and the EU delegation. I believe the version of the terms of reference that was circulated is one that was jointly agreed by both the EU delegation and the CARIFORUM Directorate. Over to you, colleagues.
Hi, Yvonne. Hi, Chair. Just to confirm from our side that we have no other input other than what we have already put in the document. We agree to the changes that were proposed by CARIFORUM, and note well that we'll await the addendum of the financing agreement to discuss the co-chairmanship and how to go forward with that. But no other comments on our side.
Thank you. Thank you, Donna. So at this time, I think we can put the revised terms of reference to the committee for adoption, with the exception of the item relating to the chairmanship of the committee, which will be finalized after the approval of the addendum to the financing agreement. Can someone move that the changes to the terms of reference for the PSC be adopted with one element to be finalized later, please? Colleagues, kindly note that any member, official member of the steering committee can move a motion for adoption of a matter and second it.
Joining again, can I move to adopt with the exception of that one element?
Thank you, Dr. Zachariah. Do we have a seconder?
I'm not sure if I can, but I can second so we can move on.
Thank you, Lisa. All right, thank you. The next item is the revised terms of reference for the Climate Advisory and Help Group. This revised terms of reference has also been circulated. And so I present to you the revised terms of reference for the CHAG for adoption, if there are no comments on it, or rather I invite comments, and if there are no comments, I put it to the committee for adoption of the terms of reference for the CHAG.
Chair, just confirming on the EU's end, there are no further comments on the document.
Thank you, Donna. So what is left is for us to receive a motion for the adoption from the steering committee. Thank you. Colleagues, the TOR is before you. Thank you, Dr. Zachariah. And the seconder, please, one time so we can move on. Colleagues, we are waiting someone to second the motion so that the meeting can proceed, please.
Madam Chair, I second the motion.
Thank you. I was about to say if there are no dissenting voices, I was going to agree that everyone agrees and then we could move on. Thank you for that.
Welcome.
We have come to the end of the first item on the agenda. The second item is EU CARIFORUM climate change. But at this time, I hand over to my co-chair, the EU delegation, to take us through the next agenda item. Thank you.
Thank you, Madam Chair. So we'll move quickly on in the interest of time onto the next agenda item. I believe that this is the update from the PAHO team on the status of activities to date. So Adriana, I believe this is you. The floor is yours.
Thank you very much, Madam Chair, and thank you, Ms. Gittins. And I'll just bring my presentation up. Okay, I'm just trying to put it into presentation mode. Thank you very much, Madam Chair. My presentation will be in 3 parts. I will present on the 4 output areas, and then our communications specialist, Ms. Lisa Bailey. Lisa will present on the communications and visibility aspect of the project. And then our programs project specialist, project support specialist, sorry, Mr. Tiber Clark will present on the expenditure for the based on the status update for the past year, as well as on the projected budget for year 4. So my presentation would also include the status update as well as the projected work plan or summary of the work plan. I'd just like to indicate that we've actually just commenced collecting the information from partners for to compile the annual progress report for year 3. So this presentation will be based on a summary of that report. The full report will be submitted to the steering committee in November, as well as the full expenditure report and the full financial report. And so essentially, we have some new members. So we thought that a little bit of the context will be appropriate. So the project is implemented by PAHO, by the sub-regional office that's based in Barbados, and the CARIFORUM Directorate, as well as the European Union, provides oversight. The implementing partners are the University of the West Indies, CARICOM, CARFA, CMIH, and 5Cs. As a part of the governance structure for the project, there is also another tier of technical and operational committees. The Early Warning Systems Committee that is led by CARFA, the Health and National Health Chapter as a part of the National Adaptation Plans that is led by PAHO, the Water Safety and Food Safety Plans led again by CARFA and Panoptosa, and the Climate Change and Health Leadership. That committee is technically led by the University of the West Indies in collaboration with CARICOM. And then we will hear in the presentation from the communication specialist. There's also a communications and visibility technical working group. The project has 4 output areas. The first output areas is to provide support to countries to pilot PAHO WHO co-benefit tools. Output 2, to provide support to countries to develop health chapters as a part of their national adaptation planning process. And output 3, to improve surveillance, early warning systems, water and sanitation plans and protocols, as well as assessments. And the output 4, to provide strong, effective climate change and health leadership to both public, private sector, as well as civil society too, as it relates to the One Health approach. During the past year, we've had 1 steering committee meeting, and this is the second meeting over the past year. And that meeting was held on the 16th of November, and we've had 3 TAG meetings over the past year also. And one of those meetings was in November, and then we had another meeting on the 21st of June of this year. Recommendations from the PSC and as well as the CHAG meetings last year, as well as on the CHAG meeting on the 21st of June, were as follows: that the project to be utilized for operationalization of outcomes for policy actions, increase engagements with national focal points of all members of all countries participating in the project, determine ways to elevate the outcomes of the project to reach to a wider audience, UWI and PAHO to address the language challenges. We will address this, and we will share with you how this these discussions are going with the University of the West Indies. Results from all 4 outputs should inform the development of the next Caribbean Climate and Health Action Plan 2024-2028. The last CHAG meeting, that meeting was chaired by Antigua and Barbuda. The chairperson was Dr. Zachariah, and these were the actions to be taken. PSC meeting, we've now added the CARIFORUM Troika arrangement that has replaced the COSAD Troika arrangement. So we've proceeded to the countries are Barbados, Dominican Republic, and Belize, Antigua and Barbuda as a part of the CARIFORUM Troika. The actions which are to be taken from the CHAG meeting are PAHO to examine with partners need for technical and financial resources for sustaining project outcomes and activities. PAHO to compile a pool of climate change and health financing agencies, facilities as an option to link various UWI fellows and their projects to particular financial agencies, facilities with an interest in the focus areas of projects. You'll hear more about our response to this in the sustainability plan. PAHO to explore with partners additional options for strengthening sustainability and ownership at the national level for activities being implemented. This also you will hear more about in our sustainability plan. Also, we took the opportunity at the last steering committee meeting that was held in Barbados. It was the first in-person meeting for both the PSC as well as the CHAG. And we had the privilege of having the Chief Medical Officer for the Ministry of Health and Wellness in Barbados to deliver the brief remarks at that session. And Dr. George left us with two points here, and those are for an in-depth review of the 4 strategic lines of action in the current climate change and health plan, and in terms of which of the goals and objectives were achieved and which were not achieved, as well as to identify gaps. He also recommended an approach that an approach be developed to determine the strategic lines of action for the new Caribbean Climate and Health Action Plan. And these are all areas which certainly PAHO has been given much thought and discussions around, and engaging partners to some extent also. As it relates to output 1, adopt and pilot the PAHO WHO tools. There are 3 countries which are piloting the full tool. All 3 countries have opted to pilot the AirQ Plus tool. And Cuba is the first are you hearing an echo from my?
Go ahead, someone else had a mic on, I've muted, go ahead.
Okay, thank you. And so Cuba is the first country to, they're almost at the end of piloting their AirQ Plus tool. The only activity that is left is for the installation to be done. And this should be done by the end of August. There was a delay in terms of purchasing the relevant equipment, but they have been able to purchase the equipment over the past months, and it is expected that this project will be completed in August. The next country is Trinidad and Tobago. Trinidad and Tobago is implementing their AirQ Plus project in 2 phases. The first phase will be completed in September, when the report would be presented to key stakeholders and policymakers. And the second phase of the Trinidad's project would be to develop a roadmap, and as well as to use the tool to influence policy development. So that phase will commence in September, and it is expected that Trinidad will complete this project over the next year. Jamaica has been, over the past year, we've received the letter of concurrence from the Ministry of Health and Wellness in Jamaica to pilot the AirQ Plus tool. And it is expected that this project will commence by September, and it will be concluded by June of next year, of 2024. So within the 4th year, the project will commence and it will conclude. In addition to the 3 countries, we have in addition to the 3 countries, there are 3 other countries, sorry, that will also be receiving some degree of capacity building in AirQ Plus. And we'll share that in our work plan for the next for year 4, as well as there are 2 other tools, Green UR and HEAT. And we found that countries were not so interested. They haven't requested to pilot any of those tools. So we thought that we will host a webinar to promote these tools among countries. And hopefully some of the countries will indicate an interest in piloting those 2 tools also. That's in our work plan for year 4 also. Output 2. And our target for Output 2 is to provide support to 6 countries to develop health chapters as a part of their national adaptation plans. And we are so far providing support to 10 countries. St. Lucia and Grenada have completed their reports, and we are awaiting approval from the ministries of health. And then Belize, the Bahamas, Haiti are in an advanced stage of developing their reports. And very shortly, it is expected that these reports, the Bahamas, their report is almost final. And I know Haiti has indicated that their report will be completed shortly also. And we hope that also Belize will complete their report over the next year. Barbados should complete their report by September. And St. Vincent and the Grenadines, Guyana, and the Dominican Republic, they are still in the process of procurement. One of the things that we have done as a part of the development of the HNAP process, and we found this to be very useful. Since there has been a gap in terms of recruiting professionals or expertise in the region, climate and health expertise, as well as and so one of the things that PAHO has done, we've developed a roster of those consultants who have been who are either engaging in developing HNAPs or would have completed HNAPs. And we're sharing that with countries so that they can actually have the expertise which were used already. But one of the things we found very useful is that during the development of the process, sometimes countries are experiencing challenges. So what we do, we peer countries. Just last week, we had a session with Grenada. They've completed their HNAPs with the consultants from Grenada, along with Jamaica. We've paired them with Jamaica because Jamaica is still in the process of developing their HNAPs. And that's, one of the things we found is that we need to put some structure to this nevertheless, but this is a process that is a layer that is added to the development of the HNAPs, and we will add some structure to it. The 5 Cs have been providing support in terms of developing concept notes for supporting countries to develop concept notes for further financing. 5 countries have been identified. These are countries which are would have either completed HNAPs or they're in the process of developing HNAPs. And in year 4, we expect that a 6th country will be identified. And 5Cs, they have, as it relates to the Bahamas, they've had their engage in the Bahamas to provide support for the development of the concept node. They're also engaged in Grenada to provide support to develop the concept node. Grenada and Bahamas, I think they're already developing their concept nodes, and 5Cs will, along with PAHO, will provide support. However, I must say at this point that a challenge has been the original idea was for the concept nodes to be developed based on the priorities identified in the HNAPs. But since the HNAP, some of the HNAPs have not been completed as yet, in addition to that, the 5Cs cannot officially use the HNAPs until they're approved by the ministries of health. That has been somewhat of a challenge. And so St. Lucia, much progress has been made with St. Lucia. The 5Cs, they were able to access the HNAP report from St. Lucia, and they will be submitting a draft concept note in August. And if that concept note is accepted, then they will move to the next stage to have a validation workshop and then submit a final version of the concept note to the Green Climate Fund by September. And Belize is the 5Cs and PAHO, we are continuing to engage with Belize. And just last week, we've had a meeting between our PAHO office in Belize, the 5Cs, and to sort of align our activities. Trinidad and Tobago is perhaps the country that is furthest ahead of the other countries in terms of developing concept notes. Concept note was submitted to the Green Climate Fund in April, and feedback was submitted from GCF, and 5Cs is in the process of reviewing that, the feedback along with Trinidad and Tobago, and hopefully the concept note will be resubmitted by October within the 4th year. As it relates to Output 3, much is being done in terms of the CARIFORUM and CMIH. They are enhancing the Health and Climate Bulletin, and a lot of work has been done in terms of improving the bulletin. The bulletin is published quarterly, and it provides information on not only on climate, but also on the health components also. And there's much progress in that area. The early warning systems model is being developed, and that is progressing. That's progressing well. And the 3 countries identified to pilot this model here are Barbados, Grenada, and St. Lucia. And then there's been other activities as it relates to the food and water safety aspect of CARIFORUM, PANAFTOSA, and the water safety aspect and the food safety aspect. Those are implemented by CARIFORUM and PANAFTOSA. And there are a number of activities I know that CARIFORUM and PANAFTOSA have planned over the next few months to build capacity now that they have gotten the concurrence from countries to implement these activities. Also, there are 2 courses which are on the PAHO online campus, and those courses are the sanitation safety plans and the water safety plans. And over the next year, the training and training sessions will be organized to pilot these courses in at least 2 countries. CMIH, as I mentioned before, they are they have been enhancing the health and climate bulletin, and their discussions on perhaps how to how the bulletin can serve various purposes. For example, for the use of the media and not necessarily only the technical professionals or other target groups, which are other groups which are currently being targeted by the bulletin. CMIH would have also produced a number of products, and here you have a view of some of these products. Output 4, we're currently in the 3rd year, the 3rd cohort is currently participating in the Climate Change and Health Leadership Fellows program at the University of the West Indies. The 2nd cohort graduated in May, and the 3rd cohort commenced in June. These are the fellows from the 2nd cohort. The photograph there, you see the tutors, Professor Ora and Professor Craig Stevens, Professor Chris Ora and Professor Craig Stevens towards the far right. And Professor Ora is towards the far left. The monitoring evaluation is ongoing. Some of the challenges experienced during the project has been there's been a delay in piloting the second aspect of the IRQ Plus tool, but that has been remedied, and the project will commence in the 2nd phase will commence in September. Key challenges also under output 2 has been relative to technical expertise, but our response to that has been to develop the roster, and that roster is being shared. As I mentioned before, one of the main challenges that the 5Cs is experiencing is the fact that the HNAP reports cannot be shared with them until they're approved by the ministries of health. So that's something that we have some planned consultations with the ministries of health, and we're hoping that that is a bottleneck that we can find a solution to. As was mentioned in the as was mentioned in the minutes for the PSC meeting, this is a continuing challenge, and PAHO and the UWI, we were in discussion on finding a solution to this. And this is where the fellows from the language barrier, because the program is taught in English, and PAHO and UWI, we were in discussions to find some alternatives. And I know that this came up also in the results-oriented monitoring review. And it was mentioned in the RUM review report, and Dr. Paulson will allude to it in her presentation on the RUM review report. Another area, sustaining, this is another challenge, sustaining the fellowship beyond June 2025. And that will be addressed in our sustainability plan, our proposed moving on strategy. And as it relates to the CARICOM Youth Ambassadors Program, we've had some challenges, and some of the challenges here are, and these were indicated in the update from CARICOM, incompatibility, in institutional incompatibility. And I think one of the things we've recognized is working with so many partners and dynamic organizations that there is need for constantly reviewing and revising how we work so that we can better align and our activities, as well as ensure that we deliver in a timely manner. So these discussions are ongoing with CARICOM. And I would like to, this has brought me to the end of the presentation on the status update. I'll just quickly go through the presentation on the work plan, and then my colleague Lisa will take over. These are the annexes for additional information. These presentations were submitted by our partner agencies, and they are also uploaded in the PSC link. And so it would be good if you can also review these presentations. It provides some additional context as to the activities which are being implemented and how they're being implemented, and also who are involved. I'm going to stop sharing, and I'm just going to now bring the work plan up for.
Hi, Adriana. As you bring the work plan up, just a query, please, for clarification. The work plan you're going to bring up includes some aspects of the budget, or do you think it would be a benefit for us to see the expenditure and then you discuss the entire work plan for us to have some context? Sorry, we can't hear you.
Sorry. Oops. Can you hear me now?
Very, very low.
Okay.
Go ahead. I can hear you now.
Okay, fine. That's a good suggestion, Donna. And so I would like to then hand over to Lisa. Lisa will present on the communications aspect of the activities which were implemented over the past year. And then Atiba will take the floor and present on the expenditure associated with the activities that both Lisa and myself would have highlighted.
Okay, I would just request one other change, Adriana, if we may, between the update to be provided by Lisa and Atiba, if we can pause between there for questions before you go into your work plan, that would be good to just have a break there for some queries on the status update. Yes, is that okay for you and everyone?
Yes, Donna, agreed.
Thank you. Please go ahead, Lisa.
Thanks, everyone. I'm going to keep my camera off just to preserve bandwidth because I'm working from home. Please confirm you're seeing my screen in full screen mode? Yes?
I can see your screen.
Good, thank you very much. Okay, I'm going to try to go through pretty quickly because I would like to be able to share 2 quick videos with you that are new products that we have created. I've included here partnerships and visibility. It's communication partnerships and visibility. And this report covers July 2022 to June 2023. But as Adriana said, yes, we are still receiving updates from partners. So this will give a summary of what we have so far. So quickly to go over the goals of communication for us, obviously to provide visibility to the EU, to PAHO, and all of the organizations that are involved in this action, to communicate the processes and outcomes around the 4 action outputs at the sub-regional, national, and local levels, to also ensure that vital information reaches and engages the public. We focus a lot on youth. We try to reach community leaders and the media to move action at the local level. We're also trying to contribute to the development of a regional climate change and health communications plan, and to encourage sub-regional interagency cooperation, as well as national interdisciplinary approaches using a One Health and Health in All policy approach for engagement. So during this period, we continued the implementation of the communications plan in coordination with partners as we seek to improve awareness of the EU CARIFORUM Climate Change and Health Project, and of course, to highlight the nexus between climate change and health. So please, I have some noise in my background that I need to make sure will not continue to do that. Okay. Okay, so as Adriana said, we also have a technical working group of communicators and communication focal points, and we meet bi-monthly to collaborate and plan not only events, but also materials. I also attend some of the technical working groups. It's not always possible to attend all of them, but I try to sit in on the climate change and health leadership, the food and water safety plans, and the HNAP and co-benefits technical working groups. I also develop communication products, I vet partner products, and promote the project and our area of work. And I also collaborate on planning of events and design trainings. So here's a snapshot of our webpage, recent stories uploaded, human interest stories that have been uploaded, and some of the past videos featuring the projects of the fellows, and also some of the youth who are working as part of the project. The page is quite active, and as I would have pointed out, sometimes there are stories on there that are not part of the project, but linked to the area of climate change and health, which I think is good. So we continue sometimes to highlight stories that are happening around climate change and health on the project page as well. In terms of activities, under training and engagement, myself and Dr. Poulsen actually attended the Global Health Conference of the Americas in November 2022. Dr. Poulsen did a wonderful presentation on climate change and health in the Americas, the PAHO perspective. I was able to also be there to moderate the panel discussion on the topic of climate change and health. And of course, I took the opportunity to highlight the project while there. The project has also supported the attendance of 2 persons from the 5 Cs from the comms team, as well as a year 1 UE fellow. You see her there in the pictures, Dr. Kim Newton, as well as a youth advocate, Ms. Ashley Lashley, also attended the Caribbean Congress on Adolescent and Youth Health that was held in Jamaica in October 2022. And they were able to contribute to the discussion on climate change and health and to promote the project there. And I thought that really went very well. I remember Dr. Kim saying that she really felt very inspired and happy to be a part of a group of young people who were so passionate to talk about health, but specifically climate change and health. And I also work closely with the 5 Cs on their Better Climate for My Health campaign, which involves other youth engagement activities as well. But you'll probably hear more about that in the 5 Cs report, so I won't go into too much detail. The 5 Cs also contracted a consultant to produce a video centered around the HNAP development process. You will have these slides, so you can click through and see the video there. And it showed some of the lessons learned and the best practices from member states who have been involved in the process. We have also disseminated materials on the project website, as you saw. This includes media releases, human interest story. 2 human interest stories were published also in the 5C's quarterly newsletter called Spotlight on Caribbean Climate. We've also done an additional study of youth perceptions around climate change and health in association with UNICEF and the report. And we are currently working on producing some infographics to highlight what came out of that study. So you will see those very soon. Hopefully at our next meeting, you'll be able to see those or before. The project also contributed financial and technical guidance to the recently piloted Solutions Journalism course. This should be launched pretty soon. There's a module therein on covering climate change. And we also attended the graduation of the last group of fellows and took the opportunity to do some videos there. So there will be more coming out from the fellowship. But while there, we also took the opportunity to speak to some of the persons from Jamaica who are working around climate change and health. So that is on my to-do list to work on. We also recently completed a series of training for media, mainly from the Caribbean, in collaboration with the Media Institute of the Caribbean. The goal was really to educate regional media about climate change and health and to identify possible stories. So out of this, they've completed now, I think we had about close to 50 journalists, which is great because journalists generally don't have a lot of time to attend trainings, but most of them attended all of the sessions. And out of that, I should have soon 3 to 5 journalists who have been invited to submit proposals for stories, and they will receive a small grant to allow them to cover these stories. It will also include support, mentorship, and dissemination of the vital pieces. Actually, pieces, not pieces. And PAHO will share those stories as well. So more on that to come. As I said, we also collaborated with the 5Cs in the promotion, and here's one of the cards of the Better Climate for My Health campaign. They not only did cards to promote the campaign, but they did cards to promote the whole nexus between climate change and health, which we continue to use. And I hope the 5Cs will continue to share them as well. I'm also in talks with the 5Cs out of the campaign to also share some of the stories from the young people. So I'm hoping to have a meeting with them soon because we have letters to my leader, we have poems, we have art. So we want to compile all of those and get those out there as well. In terms of youth engagement, we have been trying to get this finalized. I was hoping that I could come to you today and say it has been finalized, but you know how it goes. Once we have legal entities involved, we are on the final stages of, I hope, getting this letter of agreement signed with the Ashley Foundation. Ashley is she is a passionate young lady. She's based in Barbados, but her reach is global. As you can see, she was at COP26. She generally goes to COP. And she has quite a wide reach. She also has quite a long number of young, passionate people who we believe we can continue to work with to continue to prioritize and to advocate for climate change and health. So we're working on that. There are also discussions to form a climate change and health champions initiative led from the Caribbean. And so far we have interest from fellows and youth advocates in this. So more on this. In terms of challenges and mitigation measures, unfortunately, there is sometimes a lack of ownership and buy-in from some of our partners. I haven't given up. We continue to work with them. But to mitigate this, I'm also trying to focus more as we have more happening in country on country efforts and on local champions. And you will see some of those coming out of the fellowships. This will also include some technical experts. This multidisciplinary, multi-sectoral approach requires navigating multiple bureaucracies of member countries and donor agencies and partners to deliver messages. The only way we can mitigate this is to start early and try to give time to get through some of the tape that we sometimes have to work our way through, but I think that we are managing very well. For comms as well, the multi-language membership is a challenge, but we have, and I know the EU and Donna has been very strong on this. We have created all of our new products in English, Spanish, French, and where possible, we do ask the PAHO Haiti office to help us with Creole so that all of the products are done in those languages. This takes time, however. We did take the time to do it with the new products that we will see soon. But sometimes we also acknowledge that it may not always be culturally relevant or timely at the time that we want to share the materials. So that's something that we are working through. Oops. Sorry. Okay. In terms of In terms of our year 4 plans, we have new products that we will be disseminating. You will see a couple of those soon. We want to resume our quarterly advocacy and awareness events. I think you realize by now that I'm involved in quite a bit, and this is just the tip of the iceberg. So when you're doing a lot of planning and creating products, sometimes something falls by the wayside, and that has been the advocacy and awareness events. I pledge to continue doing those events and have started discussions with UNICEF and hope to involve some of the other partners in this as well. UNICEF, because we worked with UNICEF before, and that's a great way to reach youth as well. There will be more human interest stories linked to our output areas coming up, more training sessions to increase knowledge, engagement, and action. As I said, we want to formalize the LOA with the Ashley Lashley Foundation, and we've started discussions with the universities to advance research in climate change and health. This is the area that came out of many of the technical working groups. And we're also supporting the planning and facilitation of webinars to promote the WHO co-benefit tools. There are actually some products in the making around that right now. We want to continue to try to collaborate with current and new influencers, in particular youth. I recently met the new PAHO Youth for Health ambassadors. We have new youth advocates through the CARIFORUM Youth Ambassadors Program that I'm looking forward to meeting. And then the Hey campaign is an aspect of the Ashley Lashley Foundation that we are hoping to work with. Plans are in train to have a meeting around this regional communication strategy on climate change and health. My strategy will be to create a draft and then bring persons from different countries together to discuss. And then out of that, we will then be able to present something to countries that they can build on at the national level. The Champions for Climate Change and Health initiative, I mentioned this before. This is something that we are working on, and it is really a part of our sustainability efforts. And then there are collaborations to improve awareness. This includes capacity building opportunities. There is a need amongst communication officers and health education officers for more information on climate change and health and the impacts. And we also really need to keep climate change and health on the agenda of our CARIFORUM government leaders. I'm going to be leaning heavily on CARICOM for that. We were able to update the CMOs last meeting. I forget what month that was. I believe that was in April. It was in April. But we were not able to brief the ministers. So we hope to be able to brief the ministers at their next meeting. So now it's my time to share 2 quick videos with you. I promise you they are short. This is Lenise Baker, and she is one of the fellows from last cohort 2. Have a listen.
Hi, I'm Lenise Green-Baker. I'm a trained public health inspector, currently employed in the Ministry of Health and Wellness, Jamaica. The general changes that climate change has presented itself to us in the Caribbean especially is that of very unpredictable and unprecedented weather. We are seeing where our regular rainfall pattern has changed significantly. We have increased numbers of mosquito breeding sites as a result of this unpredictable weather. We have to get people to see that everyone has a role to play. Climate change doesn't just affect our lives, but our livelihood.
Take action for climate and health. Let's empower the Caribbean.
And I should have said before I started this that these, all of these products are based on the first perception survey that was done to highlight the areas that people were not as clear on. One other video.
Hi, I'm Lenise.
My name is Dr. William Hamilton, Senior House Officer at the Ministry of Health and Wellness in the Bahamas. We in the Caribbean, we have a part to play. We must also assist in reducing our greenhouse gas emissions. A warming climate can cause seawater to expand, ice over land to melt, both which contribute to a rising sea level. We live in many coastal communities. Let us start by restoring our natural infrastructure. These act as buffers against storms and coastal flooding. Things such as barrier islands, oyster and coral reefs, mangroves, seagrass, and salt marshes. They can work in tandem with things that we built, like seawalls. And the objective is to absorb storm surge. So guys, we must act now to protect our coastal communities and environment before it's too late. My name is Dr. Will.
Okay, so all of these products are also, I think you may have seen I am more from the real person to a cartoon. That's because they are also social media cards that have been created with quotes from the fellows that you see on our screen. highlighting different areas in terms of clean air, in terms of flooding and what that could cause, the severe impacts of rising sea levels, heat, something that we are definitely experiencing in the Caribbean right now, the need for keeping our oceans clear, and that it impacts our food supply, our environment, and our future. And then there are also some quote cards from the fellows as well, granted. So here are the cards. These have not been shared yet, so you are seeing a sneak peek. My plan is to share these materials through what we would call an organic share on our social media platforms and to all of the partners, but I will also put some money behind it to do some Google ads as well, because we know that that really, really works. So we will target specific countries. We may not be able to do all of the project countries because that's kind of an expensive thing to do, but the plan is possibly to focus on the countries where we are actually doing work at the same time. So in the countries that have already started their HNAPs or they're doing some of the other WHO tools, those are the ones that we will probably put the money in. But there's still time to discuss that with partners to decide what countries we focus on. Thank you very much.
Thank you very much, Lisa. And we'll now open the floor. I'm thinking whether to hand over to the chair to open the floor for questions at this point, and then we come back to the work plan. So, Madam Chair, I will, or Donna, did you suggest that Atiba makes his presentation on the expenditure first before we open the floor?
Is your expenditure tied to the work plan?
Yes.
Yes, well, we can open the floor here for questions very briefly because we're behind time. So maybe 5 minutes for questions on the status, and then we can move into we can lump the expenditure and the work plan for the coming year together. So colleagues, the floor is open for any queries you may have on what was presented. There's some queries on our end, but we let the colleagues put their queries forward first before we jump in. So please raise your hand and we will call you out to make your comments. I think this is the first PSC I've seen no comments on the status. So perhaps I'll start, get the ball rolling, and people can jump in with theirs. So I'll give you a couple of them all together, Adriana and team, and you can answer them just to put everything together. You'd noted that there were some PAHO WHO tools that were not taken up as quickly as some others, and that there was a plan to do more public awareness of the benefits of those tools. Just for clarity, could you indicate if there was any assessment as to why they weren't taken up as quickly as the AirQ Plus tool? And will that assessment then inform whatever public awareness campaign that you're likely to roll out to increase interest in the other ones? Interested as well from a long-term perspective, and you can let me know if this will be addressed under your sustainability question. The HNAPs, how do they tie to the NDCs, or can they be tied to the NDCs, and how will they feed into what countries will discuss during the upcoming COP, given that they are adaptation plans and they place health squarely in the middle of that? And just noting that there is no update provided on the Youth Ambassador Program. You did present on the fellowship program, but there was no mention of the Youth Ambassador Program. So perhaps you can give some update there. And the last thing, Lisa mentioned collaboration with Ashley Lashley and the Hay Foundation. Just because the Caribbean Youth Environment Network is a very old and established network, is there any possibility of expanding your collaboration to them? They too have quite a large reach, and their work is institutionalized, which lends to some sustainability. Ashley, as passionate as she is quite new in the arena. Just a mix of something established and new would be great. So I just leave your team to decide how you will answer those in any order, and the other colleagues, if you have any questions, you can hold them or put them in the chat for a response from the team, please. Adriana, team.
Thank you.
Okay, if I could, go ahead. Go ahead, Audrey.
No, Lisa, you go ahead first, and then I will respond to
Okay,
the
good.
other questions. Thanks, Lisa.
So we'll start at the bottom and work our way up. CYEN. Yes, I have had meetings with CYEN. Not really sure why we have not been able to move things forward. I will say that I have heard that I'm not the only one who has had this challenge. So I haven't really figured out what has caused it. And to be honest, I haven't followed up recently. So I have made a note and I will try again. I'm not really sure why it hasn't worked, but I've heard this before. So I will try again because some of the young people who we work with are members of CYN in their different chapters, in country chapters. So I will check on this again and should be able to update you on that at our next meeting. Thank you.
I see Dr. Paulson with her hand raised. Dr. Paulson, please go ahead.
Thank you very much, Donna. I'm just wanting to respond, well, along with Audriana, to some of the questions you raised. So with respect to the, and I'll keep going from the bottom too, with respect to the NDCs and the relationship with the HNAPs and the NAPs. So in the discussions and the development of the HNAPs, consideration had been taken during the stakeholder consultations to see where the countries were at with development of their NAPs and their NDC revisions. And so there's alignment in that respect. They are all at different phases. Some of them are at the point of revising. So what the HNAPs can be included as whether it is an appendix or to flesh out what is already in existence. And with respect to the NDCs also, we have a guidance document as to how countries can include health in their NDCs. And that's all part of how the HNAPs is developed. I know Audrina had mentioned earlier in her presentation about the HNAPs linking with the concept note developments. And it would be ideal if all the countries had the HNAPs developed before, because the information from that would feed into development of the concept notes and would make things a bit easier for 5Cs, I believe. But notwithstanding, there are other documents that are available from which information can be provided to feed into developing a concept note, and hence also the reason for having stakeholder consultations in countries as part of this process. With respect to the tools, I don't recall us doing any assessment as to why there hasn't been an uptake on the others, for example, the Green UR and the HEAT tool. I think more so it possibly was a result of the push that was given for the ERQ Plus and the in terms of priority with respect to what we were seeing in documents that were developed in consultation with countries, for example, their health and climate change country profiles, in which they would have identified where they were having some of the issues and prioritized. And I think because air quality was one that was high on the agenda, it's possible that that's the reason we would have pushed the ERQ Plus tool more than the others. But now we're going to go to raise or increase awareness on the other tools, because there was something done in the beginning where the tools were introduced. But I think from our end, we pushed the ERQ Plus more than the others because of what the countries were dealing with. I hope that answers those questions. So I'll hand over to Audriana now for the others. Thanks.
Thank you, Dr. Paulson. And Madam Co-Chair, I don't have much to add to what Dr. Paulson has said on the NCDs and on the NDCs, and as well as on the co-benefits, except to add on the co-benefits that it was sort of building on the responding to the needs of the countries. And the ERQ Plus seemed to have been the immediate need at the time. In addition to that, to implement pilot the Green UR as well as the HEAT tool, that also requires, let's say, collaborating with universities and planning agencies, a broader stakeholder base than the ERQ Plus. So while we've had discussions, like Dr. Paulson has said, we've not done an assessment. Thank you. Or as it relates to the CYAs, I must confess that I missed some slides in my presentation, and I realized as you were speaking, so I'm just going to bring up the slides quickly on the CYAs. Oh, for some reason, the slides are not coming up, but I'm going
Adriana,
to.
you may have them
yes.
hidden. You may have them hidden. So if they're hidden, they're not going to come up.
I may have them, sorry?
They may be hidden, inadvertently hidden. So if you're
Oh,
seeing them,
I'm seeing them, but they're not coming up on the
because if you have them hidden, they're not going to show up.
Okay, so I'm going to read them, and these are the CYAs. So the first cohort was completed and for the CYAs, and the second cohort is due to commence in the 4th year. And as it relates to there are also some other, we've also received reports from CYAs, 2 of the CYAs who would have completed their projects, and that those CYAs are from Trinidad and Tobago, and as well as St. Kitts and Nevis. And like Lisa said, when we were in Jamaica, we met one of the new CYAs. There are 2 of them from Jamaica. And so what we were endeavoring to do as a part of the support structure and to enhance to support the CYAs to complete their projects and to complete their projects. We are pairing the CYAs with fellows in the various countries. So at the summative workshop in Jamaica, and the opening workshop, we introduced the CYA who was there to the fellows from Jamaica, so that they can so that they can be provided with support. So that the next cohort will be in the 4th year, and that is a part of our year 4 work plan.
Thank you very much, Adriana. No other questions from my side, and I don't see any other questions from the members. So in the interest of time, since we've lost quite a bit of time, I'll ask you to proceed with the presentation on the budget and expenditure and the work plan.
Thank you.
Should I go first, Adriana?
Atiba, I'll just present the work plan quickly, and because the work plan is for approval in lieu, approval from the steering committee in lieu of the full work plan being presented in September. So I'm just going to quickly go through some of the activities, and then you will present. Thank you. So the work plan for the yes, I'm sorry. So this work plan includes provides a summary of activities from all of our implementing partners, as well as the we will indicate the lead agencies. So under output 1 and output 2, PAHO is the lead agency for implementing the activities under these outputs. And During the fourth year, Cuba will be completing their project. Trinidad and Tobago will enter into the second phase. They will close off the first phase and enter into the second phase of their project. And Jamaica will commence and complete their project. And the additional countries to receive training from the InAirQ Plus and are St. Vincent and the Grenadines, Barbados, and St. Lucia. We spoke about the webinar to promote the Green UR and the heat tool. And within the fourth year, also under Output 2, we will continue to provide support to those countries conducting the HNAPs, as well as we will commence the consultations. That's at number 2, consultations with 7 countries. And Grenada and St. Lucia, they would have completed their HNAPs, and we hope that the Bahamas, Barbados, Haiti, and Belize and Jamaica, that they will complete their HNAPs in year 4 also, and we'll be able to commence to have those consultations with those countries. And I did discuss before building a structure around the knowledge sharing session. And another activity we will commence in year 4 is the development of a manual with the Caribbean context as it relates to developing the HNAPs. As it relates to output, this is output 2. The 5 C's will continue to provide support to the countries, the 4 countries, because Trinidad is almost at the end of completing their submission, and 4 countries, but we also hope to add another country within the 4th year. This is as it relates to concept notes for additional financing. And the number of workshops which are planned by CARIFORUM and PANAFTOSA to implement the water and safety plans, protocols, and tools, as well as to engage stakeholders around policy development in these areas. The early warning systems activities will continue, as well as the CMIH will continue with the health and climate bulletin. There are a number of activities here. I'm not going to go through all of these activities because we've uploaded the presentation, and these are all activities which will be conducted by CARIFORUM over the next year. There's one activity here that I'd like to identify. CMIH has proposed to expand their support to the fellows. The experience of the fellows during the internship at CMIH has proven to be a great success. Hence, the CMIH is proposing to provide an opportunity to expose more fellows to their areas of their thematic areas over the next, in this current cohort, the 3rd cohort, and the 4th cohort. So that would require some budgetary adjustments. And we're also going to be discussing some of that at this meeting, and we will provide a clearer picture when we have the full reports at the end of this month from all of the partners. Under output 4, there are 2 other, this current cohort is cohort 3, and then there is one other cohort that is planned by the UWI, and that's cohort 4, that will commence in May of next year and conclude in June of 2025. And thereafter, beyond 2025, we are now thinking, we've put our thoughts into the sustainability plan. And so these are the activities proposed by CARICOM for the 4th year to conduct the training for the second cohort, and as well as continue to raise the profile of climate change and health at various levels. Lisa did mention under her presentation the communications and visibility plans for year 4. So I'm not going to go through those. When we get to the sustainability plan, these are the areas for year 4, subject to the steering committee approval and direction, strategic direction this morning. These are the areas we're proposing discussion and approval of sustainability approaches and activities with the PSC. We will raise that in our sustainability plan, the areas, formation of a sustainability group, PAHO and partners, to do a deeper dive into beyond 2025, and a development of a climate change and health moving on strategy sustainability platform with a budget. So we hope that once the steering committee approves that we can continue with this approach, we will then do a deeper dive, and then by the November steering committee meeting, present a more substantive document on sustainability. And this is, as it relates to our ask for the steering committee, is summary of work plans to approve in principle the work plans for the various partners for year 4 in lieu of our submission of the annual progress report and full budget in November at the steering committee. And the reason we do not have that full report now is because the project ended, the year ended on the 30th of June, and we usually start the process of collecting the information from the partners from the 1st of July, and that ends at the end of July. And then we start to consolidate the information into the annual progress report. Thank you very much, and I'll now hand you over to Atiba to present the expenditure as it relates to the activities which were implemented over the past year, as well as the projected budget for year 4. Atiba, please.
Hi everyone. Just let me share my screen. You can breathe a sigh of relief because I only have 3 slides, so it shouldn't take me too long. Of course, there's quite a bit of information, but I think we'll be fine. So just give me one moment while I get that's a laser pointer just in case I need it. So everyone can see, yes?
Yes, Atiba.
Okay. So thank you all for joining us. Most of you know me already. My name is Atiba, and I am the project support specialist for this project. My role today is to assist Adriana with an overview of the project's financials. So, okay, this slide demonstrates our expenditure review from 2020 to 2023, right? Highlighting how expenditure has increased in a single year. So as this PSC meeting is in the middle of the reporting period, please bear in mind these figures are preliminary. Our financial resources management team at PAHO is in the midst of a comprehensive review. So the figures may be subject to minor adjustments by the time of the progress report submission. So also beginning this discussion regarding expenditure, I should remind everyone that the total amount which you see here of funding from the EU was €6,850,000. So overall, there has been a notable 24% increase in total expenditure and obligations from the previous year, from 2 million to 3.6 million euros. This places our expenditure at the end of year 3 at around 54% of the total amount for this project. And we have spent and obligated 67% of the funds received from the EU so far. we receive about 80% of the 6.8 million. So now let's delve a bit deeper. As you can see, there's a varied rate of increase across different outputs. Of course, the funds allocated to each output is different, so the bars of the chart are scaled accordingly. In other words, let's look at the distance between the blue bars and the orange bars when assessing the expenditure and obligation per output. For example, I know the increase in project management stands out because the height of the bars, they're high. But actually, the most notable change occurred in output 3, as you can see here, which focuses on surveillance and environmental determinants of climate change and health. This saw the most significant change due to CARIFORUM receiving the largest fund allocation for year 3, with all of their project activities embedded within this output. They also carried the largest allocation of funds amongst the partners. So in terms of adjustments, we made a small adjustment last year by reallocating 4,000 euro from output 4 to communications and project management, which had no negative impact on the overall project objectives or individual outputs. And this adjustment was reported to the EU. So I'll move on to the next slide. Okay, so let's now move on to our future expenditure projections and potential adjustments. So given our current plans, we anticipate significant spending across all outputs in the upcoming period. In the first column, which is here, we have the outputs, followed by the project expenditure for year 4, which is also the budget for year 4, that covers the communication products Lisa mentioned and the activities that Adriana mentioned during her presentation on the work plan. The next column shows the total projected expenditure for the project by the end of year 4. So this is estimated at about 77% of the entire total of the project. And then lastly, the remaining column indicates the amount we anticipate carrying over to year 5, right? This is the final amount to be spent. It is important to note that although outputs 2 and 3 have the highest projected expenditure, these outputs also have the largest allocation of funds. Therefore, it's vital to also pay attention to the column showing the remaining amount to be spent at the end of year 4 going into year 5. Okay, for my last point, I'm soon finished. For my last point, I would like to talk a bit about the anticipated budget adjustments and managing them. So I should mention that UE has already indicated potential plans to repurpose savings from the project's first 4 years to finance a 4th fellowship cohort in 2024 to 2025. This will require substantial budget revisions, possibly needing EU approval due to significant fund transfers between budget lines. I also remember CAMH has expressed a desire to reallocate funds. As we continue with reporting, we need to extract the necessary information from our partners to communicate requests for adjustments in the progress report. I know some partners have already been working with Adriana to ensure that the funds are reallocated with sound financial and budgetary management. This is done by ensuring that we have the necessary information. It may not always be apparent, but changes in spending plans often translate into careful budget adjustments on our side. So having clear and structured information is crucial for enabling us to make these necessary accounting adjustments effectively. So this involves clearly showing how reallocation of funds affects all upcoming project years, hence the 5-year budget, which all partners should be familiar with because it's actually Appendix 4 of their agreement with PAHO. So we always push for everyone to update it, since it's part of that legal document. Includes verifying that the amount officially requested matches the amount in the 5-year budget, because the amount budgeted and requested, they're not the same, right? So we have to make sure that when we do see the figures that they match and they're all the same. Guaranteeing adjustments do not impact the project's overall objective or any objective in any of the individual outputs. That is why I often direct all of us back to the log frame every chance I get. I know everybody's probably tired of hearing me talk about the log frame. assuring that the budget adjustments are being recorded to avoid misunderstandings. I mean, now we have a budget adjustment form to help us with this, right? And also sound financial management involves making sure that we have justifications for all reallocations performed, and when needed, that we also have the necessary approval. So given that our partners use diverse financial systems, the standardized templates we have developed serve as the vital tools for us to monitor and understand fund movements. Without them, our visibility into the project's finance is significantly limited. So of course, we rely on these templates and other information to be completed and submitted so we can review the information. And, in some cases, we're going to have follow-up questions when necessary. So I know some of you may hear from Adriana or hear from somebody about we need information because we're just trying to make sure everything is sound on our side. So then the last slide is just really a summary of the key points. I know this was a very short presentation, but I hope it was informative. I didn't want to make it too long because I know there's a lot of presentations today. So there you have it. Here are some key points, some takeaway points I would like everyone to remember. I will now pass back to Adriana to close off the session. And then I think I remember Donna said, then we'll take some questions.
Thank you, Atiba. Adriana, if you can close off quickly in the interest of time so we can move on to any questions that the colleagues may have. And colleagues, please do raise your hand so we can get to you quickly with any queries on the work plan for the upcoming implementation period and the expenditure as reported. Adriana, please.
I have no additional comments. After the discussion session, then we'll ask the steering committee to approve our summary work plan and the budget.
Sure. Thank you. Yvonne, Chair, please go ahead. I think I saw your hand.
Yes, thank you. Just a quick question, just for clarification. I noticed the reference to the 24% increase from one year to the other. I just wanted to know what is the reference period, because whether the reference period is really from July 2022 or from the last PSC, from the last report that was presented to the PSC in November. Just that small point. Thank you.
Hi, the reference point would be the project year. So it would end in June, the end of June, and begins at the beginning of July. It wouldn't be the last PSC. All of our reports just follow the project year.
So in other words, Atiba, it would be from July 2022 to June of 2023.
June 2023, yes. I hope that answers the question.
And so the fact that the steering committee was in the middle of that in November, is there any clarification you'd like to add there?
No, because in November, the steering committee would have also used figures from the end of June. We always, all of our figures are presented in this way.
Okay. Thank you.
Okay, thank you, Adriana, for that follow-up. The reason why I ask is because I know that, and you will recall from the minutes where the steering committee would have approved the financial report as well. I did not, while he was presenting, I did not get the chance to go back to confirm what was reported during the last steering committee meeting, but it would be useful though if, now that we're having this steering committee meeting at a time which is consistent with the project year, it would be okay to do year-to-year reporting. That would be fine because the project year seemed to be July to June. But it would mean, therefore, when reporting to the second or the the steering committee that is held in the next 6 months, you would either, in my view, you would either be repeating this report, which is for the year, and not necessarily giving us a sense of where you are at the halfway point, which would be within the next 6 months. So that is just what crossed my mind. And so I do not know if it's something we may want to consider, whilst you may have your reporting done on a yearly basis, but we would want for the next steering committee meeting, which is in 6 months' time, to also get an idea of how you're doing in terms of financial progress, 6 months down in during that project year. That's it from me. Thank you.
Thank you, Madam Chair. Are there any other comments on the floor? From the floor, as Stefano had some queries in the chat with respect to the possibility of the DR being included in the training that you had presented for the upcoming period. I don't know if your team will be able to respond. Dr. Paulson responded in the chat, but I don't know if there's any additional comment you'd want to give with respect to that. Or Stefano, if you have any other query regarding the training.
Thanks, Donna. I did indicate, yes, that we would follow up with Stefano on a discussion, and I think it will come up again. I'll mention it again when I speak to the quick overview of the RUM report with the inclusion of the Spanish-speaking countries. So yes, definitely, we will follow up with him on that to see where the possibilities are for inclusion, as he mentioned a project that they're embarking on, of which I'm aware. Thanks.
Thank you very much, Dr. Paulson. I see no more questions on the floor. Sorry, Adriana.
I just wanted to make a quick point, Madam Chair, that there are two reports which are produced, the mid-year report and the annual progress report. And as a suggestion that we have been discussing, and I'm happy that you've raised it, is for the steering committee meetings to perhaps be at the end of the mid-year reporting period. So the discussions will be centered around the mid-year report and at the end of the annual progress report reporting period. So that's a suggestion that we would like to table. Thank you.
Well noted, Adriana. So colleagues, inviting you to agree first. Let's start with the work plan and budget, to agree in principle to the activities as outlined and the timelines as outlined, as well as the budget for the upcoming period. In principle, noting that there may be small changes between now and the presentation of the progress report from last year, which is expected to be submitted in September. And maybe those changes can then be presented in the end of year PSC, where the team can advise on any updates from what they have presented here, but asking for approval in principle of these two documents, the report, the work plan, as well as the budget. If we can have someone accepting and someone seconding.
I would look at accept, Adrian Travis.
Thank you very much, Adrian. Anyone to second? Noting again that go ahead.
Right. Co-chair, I was just about to suggest that once we have no dissent invoices, we should accept. Yes, thank you.
That's fine. That being said, we consider that both the work plan and the budget for the upcoming period are accepted in principle, noting that there may be minor changes between now and the next PSC, which will be highlighted in the progress report to be submitted in September. Thank you very much, Adriana and team, for your presentation. We move quickly on to the RUM report. Dr. Paulson, the floor is yours. And mindful of the time, Dr. Paulson, I don't mean to pressure you, but if you can condense any part of your presentation,
I will. I understand. Thank you. Thank you very much, Madam Co-Chair. I'm asking Lisa to share my slides because my laptop has all of a sudden gone blurry. Thank you very much. So quickly, good morning again to all. So this is a quick overview of the results of the RUM report. And this review was commissioned by the European Commission and took place this year in May. And there were 8 aspects or 8 areas that were looked at in the review, and you'll see them listed there. The entire report is accessible via the link. Next one, please, Lisa. So under each of the areas, so this was the countries that were selected for inclusion by the Commission are listed there, and then the partners who were interviewed. Next. So in terms of the conclusions, I'm presenting the conclusions, recommendations, and some responses that we have here. And I'll just highlight where some of the major areas were indicated. So in terms of the coordination area, it was agreed that this intervention contributes to strengthen the regional coordination mechanisms for health and climate change in the Caribbean. And so the project is still highly relevant. With respect to the intervention, logic, monitoring, and learning, one of the areas that was highlighted, was the need for us to look more closely at the internal monitoring system, although it seems to be going well, but there are some measures that we need to take in terms of correction and with respect also to the submission of our reports. So the recommendations to consider request for the support from the RUM design team for the log framework to be revised, and also to look at improving the timelines of the report. So we will, that is PAHO will request the support of the RUM team, and we have already started to look at restructuring the format of the reports as recommended. And to aid timely submission of the reports, we have developed a timetable through which we would reach out to partners on certain dates for the receipt and submission and timely compilation of reports. Next one, please, Lisa. With respect to efficiency, well, PAHO is overall responsible for the management of the project, and so the report highlighted that the quality assurance functions were well established, but there were some gaps highlighted again in reporting and so on, and I mentioned that earlier. With respect to recruitment, there were some challenges with having finding consultants, and those have been overcome by the different partners. We will therefore develop a comprehensive time-bound chronogram of activities as was suggested, so that we can better track when things are delayed or on target. And the budget will show, there was a discussion on the budget execution, and so we will have a presentation or which is due in September. At next PSC, we'll be able to present a more comprehensive budget. Next. With respect to effectiveness, and here she went to the consultant went to each output where there were some challenges, and she highlighted, of course, the output one, which was related to the AirQ+ piloting. In Cuba, this is successfully piloted, and in Trinidad and Tobago, work has been done there, and Trinidad and Tobago is actually moving to the next phase of policy development as it relates to the AirQ+ tool. Other resources are being mobilized to assist countries in developing concept notes, as it was highlighted, the concern that some of the countries who were benefiting under the project from HNAP's development will not be benefiting from the development of concept notes. But we do have another project actually going on now where 7 countries will benefit from development of concept notes, and then other resources are being looked at to aid countries. So it's not only under this project. And with respect to the early warning systems and other areas where there were some challenges or issues highlighted by partners, and some of them were indicated earlier too, we'll continue to engage to address some of these challenges. I know CARIFORUM is working with St. Lucia on the early warning systems and another country, and the discussions as to how to obtain the data required to develop these early warning systems is ongoing. Next, please. With respect to effectiveness, and here it relates to mainly to output 4, the CYAs, and also the fellowship program with the inclusion of the Spanish-speaking countries. So this has come up before also. And so with respect to this, the CYAs, we're discussing with CARICOM that particular program and looking at the reallocation possibly of funds to another activity that is being conducted by CARICOM. A revised work plan has just been submitted, so we will review and proceed accordingly. With respect to the CYAs, there was an issue related to the low retention of the CYAs. And so one of the suggestions that we're following up with is to introduce the CYAs to the fellows in respective countries, so that that could possibly foster some relationship and support required, additional mentorship possibly of the CYAs in terms of doing their projects. With respect to the Spanish-speaking countries, the inclusion, so we have been talking with UE, and it will require, because the program, the fellowship program is in English only, it will require some restructuring in terms of redoing the program in Spanish. That's the thinking that one of the ideas that UE has, restructuring the entire program in Spanish, but that I don't think will happen in time for the fourth cohort. One of the things I'm seeing from the comments made by Stefano in this meeting, and I'm happy to see that, is that maybe we have not been advertising thoroughly enough. We have advertised in Haiti, for example, through the PAHO country office, and we have had 2 fellows from Haiti participating in the program. So one way to overcome possibly would be to push more advertising in the Spanish-speaking countries, explaining that this program is at this point offered in English, to see if there are actually persons who can participate in the program. The other thing is that we are looking at the possibility of, for the sessions that take place, the lectures, for example, if there's a possibility to offer simultaneous translation for Spanish-speaking persons, so that and then they could do their project in their respective countries with supervision from persons in the PAHO country office, of course, liaising with UE. With respect to the inclusion of the overseas territories, that's something that was discussed, including them in the fellowship program, but it would mean that they would have to pay for themselves. And that's a mechanism that I know has been discussed, but has not been finalized. And so far, we have had 16 out of the 16 eligible countries, 11 have fellows in the program, have participated in the program. So for the other countries, the ones that had been highlighted in the report, for example, Dominica and St. Kitts and Nevis, we will of course have to push more to focus on those countries as we advertise. Next, please. With respect to sustainability, I won't go into this. As Adriana mentioned, there is a framework that will be shared in a few moments. Next. For the cross-cutting issues, there was mention of the need to encourage participation of national authorities, to look at the intersections and the more inclusion of aspects related to gender equality and rights of persons with disabilities. So we in this will request the support and guidance of the EU delegation, as we review and revise the log frame for this project, then we will endeavor to pay more attention to this area. Next. Communication and visibility. I think Lisa mentioned some of this in her presentation. There was no doubt about the progress in that area with respect to the activities, and the EU is very much acknowledged in whatever products are produced, but there are some issues related to the highlighting on PAHO's website, for example, some of the products possibly that are done by partners or linking to partners' websites. So one of the things that was recommended was that we create a repository of deliverables and documents, and that we have done, and then to look at revisiting PAHO's webpage of interventions to include links to partners. We do have some rules and policies in PAHO with respect to that, and so what we have done is to highlight some of the products that are produced by PAHO in discussion with partners. And we also have products from partners shared on our social media platforms. But we will discuss again some of the constraints related to some of these policies with the EU towards a resolution. Next. The other one has to do with being more visible and launching a visibility and pledging event. And so we are planning a regional event. As it was mentioned, the Caribbean Action Plan on Health and Climate Change comes to an end this year, so we need to draft a new plan. But as part of that, we're looking to have a bigger regional event to showcase and highlight all that is happening in the climate change and health space in the region, including this project, which Dr. Buss mentioned earlier, is a flagship project for climate change and health work in the Caribbean. And this, of course, will include partners, the youth advocates, and so on, as we promote climate change in the region. And finally, one of the things that was highlighted in the report was the need for engaging national stakeholders in the implementation and monitoring of interventions. And the suggestion or recommendation that we're putting on the table relates to the thinking was that, or the recommendation was that the project steering committee look at a way to include national stakeholders so that it will take more ownership in terms of the intervention and the implementation and monitoring of interventions. We're thinking that it's to include the national counterparts in a project steering committee would, of course, make the committee rather big. So the suggestion is to add another layer of governance possibly, and to have working group sessions with national health focal points on the project, and then have those inputs feed it from the sessions feed into the decision making of the steering committee. And we're asking if this is something CARICOM can assist with in terms of that convening. And with respect to the overseas territories, of course, they're not funded by the project, but possibly we can look at working with initiatives that are already ongoing in these countries to see how we could partner. And I think that is the last slide. So thank you very much. Over to you, Donna.
Thank you very much, Dr. Poulsen, for that very quick and comprehensive presentation. I open the floor very quickly to colleagues for any immediate reactions to the information presented. Yeah. Okay. I'm not seeing any hands, so David has a couple of inputs, so I'll let him go ahead and let the colleagues gather their thoughts if needed. Go ahead.
Yeah, thank you for the presentation. That gave a very good perspective of the results of the ROM exercise. Yeah, three comments. Considering the last issue that was presented in terms of how can we integrate the national, the beneficiary partners around the PSC, we tend to agree that it doesn't make sense to integrate every beneficiary country in the steering committee. It would stop being a strategic platform for strategic guidance, etc., etc. We would tend to favor a solution where it was more like the creation of a coordinating body or coordinating group, more than being a second layer of a governance structure. But so in favor for having a role for them and having a space where we can get them more involved and ensure that there is a proper ownership, but yeah, separated from the PSC and maybe more in terms of sharing information, coordinating, etc., etc. In different components, we see that there is this problem of making sure that all the activities are implemented also in the Spanish-speaking countries. I tend to be surprised because, of course, we cover CARIFORUM countries, and this is something that we know from the beginning, from design. So I would have hoped that this was well planned from the beginning, that even if it is not always easy because some of the entities intervening, are more covering CARICOM countries and not necessarily, Cuba and Dominican Republic. But we should make any effort possible to make sure that these two countries are also properly integrated, properly covered, and can benefit in the same way than the others. And then one last comment on the CARICOM Youth Ambassadors program. I think there is a need to take clear decisions on what can we do to make sure that, you know, I mean, something that was not very successful, we have to see what we do about it. And this is the moment maybe to take this kind of decision. Thank you.
Thank you, David. Just one comment to add to that comment. The presentation addressed the Spanish-speaking countries, but didn't address the CARICOM countries that haven't been integrated. St. Kitts was given as an example in Adriana's report. Perhaps we have now OECS on the PSC integrated integrated into the PSC. Perhaps we can seek the OECS Commission's support in that to push it forward in the countries who haven't had, who haven't been able to benefit so far from the committee. I pass it over to our chair, Yvonette. Please go ahead.
Thank you very much, Donna. I just wanted to support David's 3 comments to say definitely that we need to ensure that all of the countries benefit from the intervention. We note the issue that was reported. However, this is in fact a CARIFORUM project, and so we need to find ways to ensure that Cuba and DR, who are in fact part of the CARIFORUM construct, can benefit. I think a lot of times many people inadvertently confuse CARIFORUM with CARICOM, and so the focus may well have just been on the CARIFORUM, on the CARICOM members of CARIFORUM, but it's important that we ensure that all of the CARIFORUM states benefit from the program. I also support the other comments made by David and Donna as well, because we did see that St. Kitts was highlighted from Adriana's presentation. And as Donna rightly suggested, we do have the OECS construct, and that is also another avenue that can be used to ensure that we reach all of the countries. Thank you.
Thank you, Madam Chair. I see no other comments from the floor, and I don't think we're taking a decision at this stage, so there is an agreement. Thank you very much, Cicero, for your input, and we look forward to collaborating with you too to ensure that all of the OECS countries benefit from both the CYA program and the fellowship program. Thank you, Michelle, for noting that St. Kitts has been involved in the Youth Ambassador program. We note that quite well. So we agree, I think, as a group to go forward with the suggestions that you have put forward, because you haven't put it for decision, but I see no dissenting voices on the recommendations. So just to summarize, we do agree that the members, the national reps aren't necessarily best placed on the PSC to bloat the committee, for it to remain lean and strategic, but to have a coordinating body, and the decisions coming out of that coordinating body would be fed to the PSC for consideration and to guide the actions under the program, and for you to continue to work on the other elements brought out in the ROM report to ensure effective implementation across all beneficiary countries within the CARIFORUM construct, not just the CARICOM construct. So thank you very much, Dr. Poulsen and colleagues. And I pass back over to our chair. Michelle, would you like to open your mic and come in? And thank you, Dr. Young, for joining us. I didn't sorry, Michelle. Thank you, Dr. Young, for joining us. I didn't realize that you had joined it, and we take note of your presence, and that Diana will continue to follow the meeting. Michelle, sorry, please go ahead.
Sure, thanks so much. Just to comment a bit on the recommendation that has been made with the CYAs, that and just to clear a little misunderstanding, that the new cohort of CYAs are actually on board And there are project proposals that have been sent in, and there is a new work plan that was actually created and submitted for review and discussion. So I would say based on those based on the plans that was being put forward, that discussion needs to be had in terms of how we're going to be moving forward, and not necessarily negating or throwing out the CYA program. That's my suggestion moving forward. Thanks.
Thank you, Michelle. Well noted. I think within the recommendations, it was open for continued discussion internally with PAHO and the implementing partners, so a decision won't be taken today. We do look forward to at the next project steering committee having having a resolution. So I ask us to note that at the next PSC, based on the discussions at PAHO and CARIFORUM, perhaps because a request for assistance has been asked for CARIFORUM in this matter as well, would come to a resolve that can be presented to the next PSC for agreement on how to move forward on the CYA program, on the elements that are being implemented by CARICOM. But noting very well, Michelle, no decision will be taken today. We just note the challenges and note that PAHO will move forward with that. If there are no further comments, I hand over to you, Madam Chair, for the upcoming part of the agenda.
Thank you, Co-Chair. Thank you very much. The next agenda item is the Haiti Health System Project. I note from, again, the Co-Chair would have brought to our attention that we're way behind schedule. Notwithstanding that, I'd like to invite a presentation on the results from the main essential health services during the COVID-19 crisis in Haiti project. We would have heard from one of the matters arising that the project was extended, but that the project has officially ended in June. So we look forward to receiving the presentation on the results from that project. PAHO, over to you.
Well, thank you very much. And once again, good morning, everyone. I'm Alain Perraudin, and I will be delivering this presentation regarding the project that was implemented in the Northeast Department of Haiti during like 22 months. Initially, it was supposed to end on February of this year, but it got extended to until June 2023, which allowed us to complete the different activities that was done in the project. I'm sorry, can you confirm that you're hearing me well? Because I have some problems. Sure.
We're hearing you well. Please go ahead, Dr. Perraudin.
All right, I have some issues sharing my screen, so I don't know if somebody else can do it for me. Well, but nevertheless, I will just start talking until it is done. But as you know, the project is a bit different from the climate change intervention that we were talking about. Mostly it was a COVID-19 response project because it was planned in the height of the COVID-19.
I will share the present, Dr. Perraudin.
Yes, thank you.
Adriana here, I'll share the presentation.
All right, thank you, Adriana.
Okay.
Yeah, so as I was saying, it was planned in 2020 in the middle of the COVID-19 pandemic. And it targeted essentially to, objective was, as the name says it, to maintain essential health services during the crisis. Of course, and PAHO, the lead operator in the PAHO office in Haiti, was the HSS unit, which is the Health Systems and Services unit. But of course, we counted on the involvement, active participation of the different technical units of the PAHO office, the communicable disease unit, the family health unit, the vaccination unit, etc. So just a quick context, next slide, please. The project was planned, like I said, in 2020, because we had a first case of COVID-19 in March 2020. And as you remember, there was this concern or this threat of rapid increase of mortality or morbidity linked to COVID-19. but not only to COVID-19, but also to the disruption of health services that would be caused by COVID-19. So we targeted a specific department of Haiti, which is the Northeast Department, which among the 10 geographical departments of the country is the one that, let's say, that faces, well, one of the department that faces the most challenges in terms of health, access to health services and coverage of health services. So that's why we chose the specific department. And in addition to that, it's a department that borders the Dominican Republic. And there's a very important market between the Dominican Republic and this specific department. So you can imagine at this time, there was a concern of transmission of COVID-19 from one side of the border to the other. So that's why we focused our intervention in strengthening access to health services, essential health services at the specific department. Next, please. Well, the project objectives was the general objective was to prevent mortality directly related to COVID-19 and the increase in indirect mortality based on the disruption of services that could be caused by the COVID-19. And specifically, it was to strengthen the primary healthcare approach in the department so that we could reduce the effects of the COVID-19 pandemic. 4 results were identified. The first result was related to strengthening governance and surveillance at the local level. Second result was related to the provision of essential health services. The third result was related to human resources for health, specifically first level human resources, first level institutions and family health teams. In Haiti, we have a strategy, the community health strategy, which organizes first level provision of services in what we call family health teams with community health workers and community nurses who leave their health facilities to go on the field to get to the populations, especially the population that live in very rural areas. So the intervention was, we also targeted the human resources, specifically the human resources at the first level of care, so that they can get to the most remote areas. Like I said earlier, the Northeast Department is one of the departments that faces the most health challenges in the country. And finally, the last result was related to medicines, medical inputs, material, etc. And you can see clearly that we targeted 4 of the 6 building blocks of health systems. And I think that's one important one important point in our intervention is that we have a more integrated approach in in the technical cooperation that we provide to the department or to the Ministry of Health in general. So some quick results regarding the governance and surveillance. They faced many challenges for the daily functioning of the departmental directorate. So right now they are fully functional because we managed to give them to install a solar energy system, which gives them energy to coordinate or to do their day-to-day work. And also we installed a very efficient communication system that allowed them to, like I said, coordinate health actions in the department. In addition, and I think that's very important for us in terms of sustainability, is that we managed to install a culture of supervision in the department. It was not done before that. And with the project, we managed to develop this culture that allowed the departmental directorate of health to have a good overview and to ensure its leadership in the different health facilities that are functioning in the department. So we managed throughout the project to have more than 75, more than 60 at least, supervision visits and also coaching visits, which allowed us which allowed the departmental directorate to strengthen its leadership or its influence in the department. Next, please. In addition to that, capacity building, various capacity building sessions, but what's important to mention here is that what you see here, these capacity building sessions were carried by the departmental director. We supported them but they were planned and implemented directly by the actors, the local actors of the department. And of course, PAHO was there to support and to ensure that everything is going well. I will not go in the different numbers, but there are two lines that I will highlight. For example, you can see that 44 health officers and inspectors have been trained on surveillance of epidemic outbreak. That's very important because we did this, or the department did this training for the COVID-19, but currently in Haiti, we're facing a cholera outbreak. And these same health officers are currently working at the department to ensure surveillance of cholera in the department. So which is very important in terms of sustainability, is that, of course, we train them in the context of the COVID-19, but what we provide with them is currently serving them for other interventions that are currently being implemented, notably during the cholera outbreak. Also, we installed jointly with the Directorate of Health 20 health committees. Health committees, it's a strategy that has been adopted by the Ministry of Health, is to ensure involvement of local actors, non-health actors in health activities. So we managed to install 20 health committees based on, well, it's talking about primary healthcare, we talk about community involvement. So that with this project, we managed to install 20 health committees in the department, and they are currently, despite the project ending, they are currently in place and making regular meetings to address or to discuss about health issues and to propose, let's say, adapted, locally adapted health interventions to address main health issues of the department. So it's like something that we live with the, of course, right now the project ended last month, but still it's like some products or some results that remain after this project. Next, please. Yeah, also in the Northeast Department, there is a National Ambulance Center that was also facing many challenges, and we managed with this project to strengthen its functions. We repaired 2 of their ambulances, ensured that they have a regular supply of fuel, and installed also a communication regulation system that allows them currently to regulate transport of people in the department, transport from their homes to the health facilities that are closest. We did a very important training of 90 paramedics from 2 departments, the North Department, which is the main target of the project, but also a neighboring department, which is we did it for the Northeast Department, but also the North Department, which is a neighboring department. And we trained them 90 paramedics on emergency management in the referral counter referral system. Regarding blood safety, of course, these are just a quick overview of the results. There are many more results, but we just wanted to mention this one because they are, let's say, the most important for us. In terms of blood safety, we managed, and it's the first time that the blood safety program managed to do that. We managed to carry out 25 mobile blood drives in the period of 18 months. And that allowed us to collect around 275 bags of blood that were made available to the different health facilities in the department. So it's like let's say a premiere for the department because it's the first time that the Northeast Department managed to collect this much blood bags, blood products in such a short period of time. Next, please. Some quick pictures. On the left side, you can see the training that we did for the National Ambulance Center in the Northeast. You can see some trainings with the local actors. If you can go down, please. Of course, different pictures of different activities that we implemented. This lady in the blue jacket is a community health worker. As I said earlier, talking about the community health strategy of the Ministry of Health. It's one of the community health workers that we train and that we equip so that they can carry their activities in the communities go to reach people in their houses to deliver the health services, the essential health services. Next, please. In terms of maternal health, also, like I said, it was maternal health is an essential health service in Haiti. So in terms of maternal health and jointly with the family health unit and the country office, we managed to establish 4 maternal death surveillance committees. And it's once again a premiere in Haiti because, of course, in the past, there has been maternal death surveillance committees, but they were not sustained. And with the project, we managed to establish 4 of them, which are composed of health professionals, but also local leaders to ensure surveillance of maternal death and propose adequate action to reduce, of course, the barriers to maternal health service in the community. So in addition, 64 service providers were trained on surveillance of maternal death response, cervical cancer screening, and during mobile clinics, we managed to identify around 24 cases of precancerous lesions for cervical cancer, and they have been transferred to adequate facilities for management. So once again, in terms of sustainability, right, these maternal death surveillance committees are formally established with their terms of reference and fully functioning currently in the department, which will ensure at least to reduce or to control, let's say, the maternal death issue in the Northeast department. Next, please. More capacity building session. I will not go through the numbers, but just to mention that the chronic diseases remains one of the, let's say, least not a priority in Haiti, right? But still we manage, but there are some protocols, so still we managed to train, to put it forward in the department and manage to train various health professionals on chronic disease management. Breastfeeding, mental health, we train around 68 community health workers on the psychological first aid document of PAHO, which allowed, of course, with all the challenges that we're facing in Haiti, you can suppose that there's a very important impact on mental health of the citizens. So, of course, we would be using the community health workers and their work on the field to deliver this psychological first aid within the communities, right? And also on same goes for gender-based violence. Next, please. Quick pictures once again. On the left, you can see a mobile clinic that was done in the Northeast. You can see all the patients here that are waiting to get checked. And on the right is one of the trainings. The colleague in the middle with the blue jacket is the PAHO colleague, is responsible for mental health. And that was one of the training sessions that was carried for the community health workers, who after this training was deployed on the field to deliver this psychological first aid package that we are currently implementing. Next, please. Of course, regarding the last result expected, like I said, it was related to medicines, medical equipment, different inputs. We managed to rehabilitate 3 first-level facilities in the department. And of course, this was not planned on the original work plan, but it was requested by the department and by the central level of the Ministry of Health. So we used part of the funding to rehabilitate and ensure adequate functioning of 4 first-level facilities in the department. Of course, continuous provision of input materials and equipment for 4 major health institutions of the 2 main cities of the Northeast. Upon request also of the departmental directorate, we purchased and installed a 150 kilowatt generator at the Fort Liberty Hospital. Fort Liberty Hospital is the main hospital of the department. And since for the last couple of months, there was some challenges regarding regular electricity, right? So in order to maintain the provision of essential services in the most important hospital of the department, it was requested that we help them in purchasing a generator. So we did that and installed it in the Fort Liberté Hospital. And currently that ensures that the hospital can work 24/7 to provide its the services as it is requested from this hospital. And finally, an important result is that there's a hospital in Mont Organisé, which had its operating room closed because it needed some repair. It has been closed for a couple of for a long time, right? And they asked us to help them to rehabilitate it, so we did. And right now, it is a very functional operating room that delivers multiple surgeries for maternal health, orthopedic surgeries, different traumas that come in the Mont Organisé Hospital. I will show you some pictures in the next slide. Please, Adriana. Yeah, so you can see the big generator that we bought on the left. On the right, there's the work that we did in the operating room. We purchased the lamp, anesthetic equipment, and of course, we trained the personnel of the hospital also to manage the anesthetic equipment, etc. So currently, the Mont Organisé Hospital is fully functional. The surgical room is fully functional, delivering surgical surgeries on let's say every day. And on the down, there's a car there's a vehicle that was bought for the implementation team of the project, and of course at the end of the project we lended it to the departmental directorate so that they continue carrying their functions in the department. Next, please. I think that's the slide regarding the indicators. All right, so for this project we followed we established initially 23 indicators. There were 3 that were put aside after discussions with the departmental directorate, and we had to follow 20 indicators for the project. I will not list the indicators, so I just wanted you to know that for 13 of the indicators, we did more than what was expected. We had a performance of over 100%. For 3 of the indicators, we were between 75 and 100% of performance. And unfortunately, there were 4 indicators that did less than 75%. So, of course, maybe you can discuss that after, but just wanted you to know that overall, for most of the indicators, we have a very good performance after an assessment that we did jointly with the department a couple of weeks ago. In terms of opportunities and perspectives, this is the next slide, and sustainability also. I think what made the strength of this project is that it was continuous to other projects, COVID-19 response projects that were implemented in the department. So before that, we had another project funded by the IDB that was also COVID-19 response. And we used this previous project to plan this project of maintaining essential services. And I think that made a very big shift because there is a very good continuity to the different actions that were implemented by the different projects in the department. But also, as I mentioned earlier, some of the results that we achieved during this project is helping other interventions in the department. And I mentioned earlier the cholera response. Right now, there's a cholera outbreak in the country and also in the Northeast department. And the same people, the same health professionals, the same actors, the community health committees that were formed and trained in the department are currently fully involved in the cholera response in the Northeast department. Also, we, in terms of governance, we ensured financial autonomy of the DSNA, is like the Direction Sanitaire du Nord-Est, is the departmental directorate of Northeast. So through various letters of agreement, now you're going too low, sorry. during some letters of agreement, we managed to let them manage the funds, parts of the fund of the project. And that's why there were different activities that were directly implemented by them in order for us to ensure that they have a very good ownership of what we were doing and to strengthen their capacities to let's say to manage big funds. Can you go back, Adriana, please? I think there are 2 points that I need to mention. Yeah, okay, that's okay. Oh, yeah, thank you. Yeah, so we also made a big focus on some programs, health programs that are, let's say, neglected, notably chronic diseases, mental health. I already mentioned that on the slides earlier. And also, before leaving the project, we managed to develop different plans in order to ensure continuity of the activities. So that's why there's an available plan for the, let's say, follow-up of the training of the different healthcare providers that have been trained during the project. So right now, the department has the capacity to continue the trainings for to continue building capacities for these healthcare providers. Next, please. We made an inventory of the different equipment that were acquired, and we have a maintenance. They have a maintenance plan for these equipment. But one of the issues that we have is sometimes we receive, the country receives some equipment, and there's a maintenance, and of course at the end they become useless. So we developed with them a maintenance plan for the different equipment, so that, of course, on time they can still ensure the best performance of these different equipment that we bought. Continuity plan for the national strategy of mobile clinics, same thing. Like I said, we have the terms of reference for the surveillance of maternal death and response committees, and currently they are still functioning, and coordinating health actions in the department in most rural areas, notably, so that they can manage, control, and prevent maternal death in the department. And of course, this experience in the Northeast, we saw that in the closing ceremony of the project. We will use it for other projects. I have another slide talking about that. Can you go down, please? Yeah, so there's a quote that I caught, and just to inform you, and I think it's very important, is that capitalizing on the achieved results and based on the implementation of the strategies adopted at the national level, the project serves as a successful experience for the planning and implementation of other projects in other areas of the country. And to be very specific, Dr. Maureen Birmingham mentioned it earlier. Currently, we
Chair, I believe we've lost Dr. Parada. I don't know if we want to continue. Anyone else from his team? Would like to continue. I leave you to advise on how we should proceed.
Madam Chair
yes,
and Madam Co-Chair,
yes.
Dr. Victor is also Dr. Victor
Yeah.
is also providing support to Dr. Paradin.
Yeah, I'm sorry.
Okay.
I'm sorry. I'm sorry. I had a very problem with the connection, but just I think that was the last slide. Just wanted, like I said, we are currently implementing another project funded by the EU and through the WHO and UHC partnership that is currently being implemented in the Southeast Department, which is another department neighboring the Dominican Republic. It's not a COVID-19 project, but it's a primary healthcare project. So I think the next, I think there are some pictures to finish. Yeah, so it's closing ceremony of the project with the different actors from the department, from the central level of the Ministry of Health, and different actors in the community. On the upper right part of the slide is Dr. Colin Victor, that you know. and she was the field coordinator of the project. And the down left is a representative at the central level of the Ministry of Health, and is specifically responsible for decentralization of health services. And he was also part of the closing ceremony that was done last month, and on the 28th of June. And finally, on the down right part of the slide is Dr. Pedro Lopez. I think some of you know him already. Is the HSS advisor of the office in Haiti, but unfortunately he couldn't make it to this PSC meeting today. Thank you very much. I think that's it from our side. And Dr. Victor, I think everybody from the country office in Haiti will be very happy to answer any questions or provide any insight regarding the project. Thank you very much for your attention. And once again, sorry for the brief disconnection. So thank you.
Thank you very much, Dr. Perrodin, for that comprehensive report. We noted that you would have not spoken of all of your results, but highlighted some key results, particularly those with some elements of sustainability. You've also showed some of the synergies with other projects, and you know, as we said, we hope that there are lessons that can be learned from how that project was implemented. So at this time, I open the floor for any comments, questions to Dr. Perrodin. I'm not seeing any hands, and I guess I can take this silence to mean that we are all satisfied and comfortable with the presentation from Dr. Perrodin. So in the interest of time, I'd like to thank Dr. Perrodin and the team, and I move on to the next agenda item, which is update on integrating sustainability into both project outputs, implementation, and looking at the transformations of project outputs and activities. Adriana, I'm not sure who is set to do that presentation, but over to you.
Thank you, Madam Chair. I will do the presentation, and I'll make it brief and very brief. Oh, sorry. Oh, sorry, that was a mistake. Okay, so we're in the 4th year of the project, and we've been having a lot of discussions around sustainability internally in PAHO, as well as with our various partners with the EU. It came up at our previous steering committee meeting, as well as the CHAG meeting, and PAHO was tasked with putting some initial thoughts down so that we can come back to the steering committee to get with a proposal as it relates to some kind of framework for a mechanism for sustaining the project. So we came up with what moving on strategy, and moving on as against an exit strategy. So the project comes to an end in 2025. And the idea that we're proposing is for us to develop a moving on strategy, that the project moves on to something else. And the four pillars, if we can call it that, around which this framework will be built are around formation of a sustainability group, which could include PAHO and partners, and the EU, the CARIFORUM, to facilitate transformational processes, transitions, mobilizing additional resources, etc. And the transition steps, what are the steps to transitioning the project outputs and activities into programs, so to speak, as you would see in under transformation. And how can these projects, these activities become programs? and resourcing, both technical and financial resources to explore opportunities for resourcing. And for example, mapping of climate and health financing, development of proposals and linking projects. UE, the fellows from UE, they have been submitting projects for possible funding. They are implementing projects as a part of their program. And UE has already submitted 2 concept notes for sustaining the UWI program. And some activities can be institutionalized. So we're proposing that this group examine a little deeper which activities can be institutionalized and which can be scaled up in different ways. And Dr. Budram from CARIFORUM did mention in the sustainability plan that they had submitted, CARIFORUM and CMIH. They've already they highlighted that some of the activities are already institutionalized, like the HCB bulletin is already institutionalized, and this project is helping to enhance it. Dr. Budram also indicated from the CARIFORUM standpoint in terms of how some of the EWS early warning systems models can be institutionalized, and within CARIFORUM, they have proposed some of that in CARIFORUM as an institution. And so what we looked at the various outputs, and we're already sort of pulling out some activities from the various outputs, which we think can be scaled up. And Cuba, Jamaica, Trinidad, and Tobago, they're currently piloting the AirQ Plus tool. As such, they're 13 out of the 16 countries which can be supported. And so perhaps if we think of sustaining this project, there are 13 countries. This project piloted the tool in 3 countries, but 13 countries can benefit from piloting the full tool. And then the other 2 countries, Jamaica, Trinidad will also be using the tool to influence policy development. The Jamaica and Cuba, those countries will only be piloting the tool, but under the project, they will not have the opportunity to use the tool to influence policy development, except they implement that aspect on their own, independent of the project. And scale up is a general theme throughout the sustainability plan, which activities can be scaled up. And we would like to present some scenarios. Improve surveillance capacity of professionals in health and health determining sectors. And these are some of the areas. I wouldn't go through all of them in detail. The presentation is uploaded in the link, but these are some of the areas in which CARIFORUM and CMIH, they're proposing to sustain the outcomes and the activities. I must say that CARIFORUM and UE, they have already begun to flesh this out a bit more in terms of in terms of how their components and the activities can be sustained. So you would see that CARIFORUM has, and CMIH, UE, they've proposed a very detailed at this stage, for this stage, at detailed proposals as it relates to how they can, whether it be institutionalized, whether it be how they can scale up some of the activities. And that's commendable. And then here you see, like I said before, CMIH, they've already indicated, and CARIFORUM, that the HCB bulletin is institutionalized because it was being developed prior to the project by the institutions. But this project allows for the enhancement of the HCB bulletin. So after 2025, CARIFORUM and CMIH are proposing that this will continue and they will build on what the benefits from this project. And there you see it in terms of food safety, water safety plans, and in terms of CARIFORUM and CMIH, they've even identified not some of the transformation null approaches that can be taken, which activities they're proposing to institutionalize. Of course, funding is a factor. UWI has submitted 2 project proposals. One is the Caribbean professionals. One proposal is to the establishment of a secretariat for fellows. This is sort of a network, a community of practice for the fellows so that they can continue the work of the good work which they have started. The other proposal that UE has submitted is maintaining the climate change and health fellowship program. This is within the institution of UE. They've also proposed budgets for both of these proposals, and those are being reviewed. We're also proposing, as a part of the sustainability platform plan, to establish a Champions for Climate Change and Health initiative. PAHO and partners, Lisa mentioned it earlier. We've already started to have discussions with partners to build out the idea. And this Champions for Climate Change and Health, we're thinking countries, for example, can become champions for climate change and health. We're still developing the criteria. Perhaps they can have, once they have the HNAPs, they have a strategy, they have policies, they've institutionalized, they've budgeted. We're still fleshing that out. But we've come here to the steering committee to get from you if we're moving in the right direction and if we should continue to do a deeper dive into these ideas. Another idea that came up, and this Champions for Climate Change and Health can be a country, it can be institutions, it can also be professionals, and it could be youth advocates, and the Climate and Health Wise Community Initiative. One of the areas that keeps coming up is in terms of increasing awareness at the level of at the national level. And we thought that perhaps a Climate and Health Wise Community Initiative, this could build on some of the work that the fellows have already started to do at the level of the community, the fellows and the CYAs, at the level of the community. But it is putting that in some kind of, it's packaging it really, and in the Climate and Health Wise Community Initiative. This is something, as well as the Climate and Health Wise Schools Initiative, because some of the fellows are implementing some projects in schools. So this will provide a package for that. In addition to that, to put some structure to it too. But in addition to that, this would also be at the end of, beyond 2025, then countries will have some kind of mechanism that's called climate and health, how to determine communities how to determine which communities are climate and health wise communities, maybe climate and health wise schools. These are all ideas at this point in time. And we're proposing that PAHO, UWI fellows, CARIFORUM, that these can be the agencies implementing this along with other partners. These are on the communications and visibility. Lisa would have mentioned this, but we're hoping to develop a Caribbean climate change and health communications plan, which will sort of have standardized regional communications, perhaps around climate change and health, with some key messages and some key core messages around which that can be done, as well as a Caribbean climate change and health communications network. One of the things we've been discussing with Lisa is one is in terms of informing and creating awareness, but also behavioral change. And so this will also encompass that behavioral change component. Next steps. And here is where we're beginning to have this discussion here, having put our thoughts down on paper with you, members of the steering committee, and for your strategic direction in terms of whether we can continue to develop these approaches more, to flesh them out some more, and bring a more substantive document to the steering committee meeting in November. And formation of a national sustainability group. And we already have an ad hoc, I would say, group who we've been discussing sustainability with, development of a climate change and health moving on strategy, the sustainability platform with a budget. And this is what, if we get the go ahead from the steering committee, the approval from the steering committee, then we can come back to the next steering committee with a more substantial moving on strategy with a budget. Thank you, Madam Chair.
Thank you very much, Adriana, for that presentation. Colleagues, Adriana has presented us with a number of options for sustaining outputs and requires the guidance of the steering committee on whether they're moving in the right direction and whether to flesh out the areas more for consideration of the next steering committee meeting in November, later down in the year. And so with this, I open the floor for your feedback. You may raise your hand or so that we can see who would like to speak, please. Thank you.
Hi, Madam Chair. I have my hand raised. I don't know if you.
I am. Yes, you may proceed, Donna. I'm looking, but yes, I'm only now seeing it. Probably mine is a bit delayed, but you may proceed. Thank you.
Thank you. Thank you very much, Adriana, for a very comprehensive presentation. I would say at this stage, it was quite a bit of information. And I don't know if anybody else on the committee is as visual as I am, but it would benefit from having a document that kind of laid out everything that you said, to be able to review and kind of digest that, to be able to provide approval or comprehensive guidance. So on our end, for the delegation's end, it would be difficult to approve at this stage without having a document to kind of review. Having had a document to review prior to kind of get the context that you would have provided here. So from our end, Madam Chair, I would prefer to receive something in writing that kind of lays out the framework towards, a more detailed document for the next PSC, yes, but at this stage, even having a skeleton kind of frame of what that looks like in writing for our review, especially since you have funding, et cetera, and you're requesting future EU support potentially to kind of look that through and provide comment. But unfortunately, today, the absence of that would be difficult to be able to provide that.
Thank you for your intervention, Donna. I see a hand of Mrs. Helen Royer. Mrs. Royer, you may proceed with your intervention.
Thank you very much, Mrs. George. Thank you, colleagues, for a very comprehensive presentation. I just wanted to ask one question in reference to the initiative, the Champion for Change Climate Change project. I just wanted to know what would be the process of engagement of member states, whether we'd be doing that for CARIFORUM or PAHO. How would we go about it? So I think I want to support my colleague that maybe a document detailing exactly the processes and what is expected at the level of member states and the intervention that would be needed from CARICOM be explained. Thank you very much, Chair.
Thank you very much, Mrs. Roy. You may lower your hand, Mrs. Royal. While I check for any other persons who may want to. Yes. Okay, I'm not seeing any hands, any requests for the floor as yet, but I think from what Donna would have indicated, followed by Mrs. Roy, there are two elements to this. One, the fact that even the information that was presented today was not submitted in advance, so that colleagues would have gotten the opportunity to peruse it before and provide some more informed feedback, as well as the further detailing of the program for consideration at the next the proposal, sorry, for further consideration at the next meeting of the steering committee. I would like to propose that the presentation that was made today be circulated to members of the steering committee and, for possible feedback within 2 to 3 weeks or some time frame, even while Adriana would further develop the proposal to be submitted as one of the papers for the meeting of the next steering committee. Donna, I do not know if you have any other suggestions in terms of how we can proceed, because it would be useful for us to even already be able to have a look at what Adriana has presented today in a bit more detail. I see before you come in, Adriana, there is a request for the floor from the EU delegation in Barbados. You may proceed.
Thank you very much, Madam Chair. And in the interest of time, I do think the presentation will be useful, yes, but there's still, for me, looking at the information there will still be some questions and gaps, and I don't think it will allow for full understanding of the framework. I know that a very detailed document will be presented at the next PSC, but if we could even get a document at this stage that outlines the proposed framework before you go into any more detail to be presented at the PSC, in the intervening period, I think that might be a little bit better than the presentation, and allow for us to understand how it was conceptualized and what further detail we should expect. So that would be my suggestion, that within the next couple of weeks that PAHO provides us with a document to accompany the presentation for further elaboration where they can, towards maybe a round robin approval of the general framework, to allow for more details to be presented at the next PSC. But that's my suggestion.
Thank you, Donna. I think basically I agree. What I was really suggesting is that something comes to us now, even before the next meeting of the steering committee. So that is fine. Adriana, you may proceed. I see someone saying agree in the current person. Okay, in the chat. Adriana, over to you.
Thank you, Madam Chair and Madam Co-Chair. We did upload the presentation as well as a narrative, but I must confess we uploaded them late. So perhaps like you said, that there is that initial document just with ideas. And so if the steering committee members, if you have any feedback, that would be very useful in terms of us thinking around these areas some more and integrating some of your thoughts into how to do that. Thank you. So the presentation, the PowerPoint presentation, as well as the narrative, they were uploaded to the link, the PSC, with all of the other PSC documents, but they were uploaded late. Over to you, Madam Chair.
Thank you, Adriana. I know that I would have reported I was having challenges accessing the link, and so I would have been depending on the document being sent to me directly. But when Donna intervened, I really just assumed they were not uploaded. So thank you for that. Donna, do you have any further comments based on Adriana's response?
No, I acknowledge that they were uploaded late, so it still didn't provide the time for review. So happy to review what you have there, and we can provide comments.
Yes, okay. So at this time, I'd like to propose that based on Adriana's response, and given that we accept that the documents were uploaded late and persons may not have had the time to provide feedback, I'd like to propose that as a decision coming out of this meeting, that members would be allowed, what, a week or 2 weeks to review the document and to provide Adriana with feedback within 2 weeks of today's meeting. Okay. I think this takes us to the end of this agenda item. And I will turn over to Donna to take us through the final item, which is the conclusion of the meeting. Thank you. Donna, over to you.
Thank you, Madam Chair. And because we're very behind, I'm just going to go through some summary outcomes of the meeting. And please, Madam Chair, please feel free to add any that you would have noted on your side. I know that we've adopted the CHAG TRR. The PSC TRR has been approved in principle, noting that the full adoption is pending the addendum to the financing agreement with respect to the section that refers to the EU's position as co-chair. The annual work plan and a budget for the upcoming period were approved in principle as well, noting that there may be minor adjustments that will be reflected in the progress report that will be submitted by September. Noting that we had a discussion on the alignment of the PSC timing with the schedule for reporting so that we can have a full view of what's happening, discussion of what's happening in that period during the PSC, and PAHO will review that schedule and aligning of that timing. We note that for the budget, the expenditure is expected to increase in the upcoming period, and that there have been tools designed to standardize reporting to improve accuracy, etc., and that the ROM recommendations will also be taken into consideration. We note well that the steps have been taken to align the HNAPs to the NDCs. We also note that there will be continuous action to engage with CYEN as an established partner with respect to youth engagement. We note that the operational issues that were highlighted in the ROM report, i.e. monitoring and evaluation, reporting, the log frame, will be addressed by the next PSC with the support of the delegation and CARIFORUM where needed. We note that the decision was taken for national reps to be engaged, but through a coordinating body that will function outside of the governance mechanism, but will inform the governance mechanism in their decisions, both the PSC and the CHAG. We know that there are challenges with the CYA program, and those challenges need to be discussed more fully with PAHO and with the support of CARIFORUM towards a resolve, and that resolve and the full plan will be outlined by the next PSC meeting. We also note that all project activities noted and agreed should be guided by the CARIFORUM construct and benefit all the countries under the program, including Cuba and DR. That support can be given to for the increased engagement with DR through the CARIFORUM Directorate, and support for increased engagement with the OECS countries through the OECS Commission, particularly for their engagement in the fellowship program, noting that they have been engaged in the youth advocacy program under CARICOM. We note the successful completion of the Haiti program and all the efforts taken to support sustainability through the establishment of committees, strengthened capacity, strengthen programs, etc., and congratulate the team on the completion of the work under very challenging circumstances. And lastly, I have here that we note that the membership will review the documents presented on the sustainability plan and provide comments within the next 2-week period. Outside of this, Adriana will update us on the date of the next PSC meeting, but I stop here to allow you, Madam Chair, to input any conclusions that I may have missed.
Thank you, Co-Chair. No, I think you would have noted all of the conclusions of the meeting. So I think, yes, I turn over to Adriana for the meeting of the next PSC. I'm not sure if we were expecting any other business, but as I said, Co-Chair, this is your item, so I depend on you to guide us through.
I think in the interest of time, there's no space for any other business. I would suggest that if there are any other concerns, that they be shared with PAHO, and we can certainly address them that way, unless they're very burning issues. But I don't think so. So I would just hand over to Adriana if you can close us out with the PSC meeting, and we'll make some closing remarks and allow people to get to their lunch, especially those in the Eastern Caribbean area. Please, Adriana, the floor is yours.
Thank you, Madam Chair and Madam Co-Chair. The next PSC meeting will be on the 22nd of November in Grenada. That will be our in-person PSC meeting. We have our next CHAG meeting will be an in-person CHAG meeting on the 6th of September in St. Lucia. And just to quickly say that one of the reasons why St. Lucia and Grenada were selected is because they have completed their HNAP reports, and we're also hoping to engage the stakeholders in consultations on identifying priority areas for additional support from the recommendations in the HNAP report. Dr. Paulson, I see, okay. So that's nothing to add. Thank you. I would just like to say that to thank the team that we work with under the leadership of Mr. Dean Chambliss, the Sub-Regional Program Director, Dr. Daniel Booth, the Unit Chief for Climate Change and Environmental Determinants of Health, Dr. Paulson, who's already a champion for climate change and health. And she's really been providing us with really good support, technical, operational, etc. The project team, Atiba, the project specialist, Lisa, the communication specialist, and Annie, who is behind the scenes many of the time, but so critical in terms of her support. Annie is the project specialist. And to our colleagues in the sub-regional office, as well as in the Washington, DC office. I'd just like to take this opportunity to say thank you for all of your support. Thank you, Donna at the EU, for your patience, your support to us, as well as CARIFORUM. Many thanks to all of our partners, CAR4UE, CMIH, and CAR4UE, CMIH, CARICOM, and that's why you don't start calling names.
The 5 C's.
5 C's and 5 C's. A big thank you.
Thank you very much.
Hand back over to you, Madam Co-Chair.
Thank you very much, Adriana, for those thanks. And I also want to thank your team as well, and the team within the sub-regional delegation and the implementing partners, and also extend that thanks to our teams in Haiti, the delegation there, and the PAHO office there as well, for the tremendous work that you did and were able to successfully complete under some very difficult circumstances. Just our congratulations. There's nothing else to add from this end other than we look forward to the successful continuation of the program and remain available to provide what support you need. I look forward to working with you as we go forward. And I leave the final words to close us off to our chair from CARIFORUM.
Thank you very much, Donna. Thank you for co-chairing today's meeting. Thank you to Adriana and the team as well, and to the sub-regional office in Haiti. Thanks to all the implementing partners. And we at the CARIFORUM Directorate also stand ready to provide Adriana and the team with whatever support that is needed as we continue to implement this very important project. Adriana, I have noted that the meeting of the next steering committee is on a Wednesday in Grenada. The 22nd of November is a Wednesday. Thank you for that. Thanks, everyone. Thanks for joining today's meeting. And with this, we'll bring this meeting to an official close. Thanks, everyone.
Thank you, Madam Chair.
Bye.
Have a good day. Enjoy your lunch. Yes.
Thank you.
Yes, cheers.
Thank you, colleagues. Have a good day.
Bye.